السلام عليكم والله يعطيكم العافية جميعا. عم تسمعوني؟
وعليكم
يعطيك العافية.
السلام.
طيب، السلام عليكم والله يعطيكم العافية جميعا. معكم مجد جزائرلي. نحن اليوم حنعمل السكند سيشن اوف residency boot camp. The session will be recorded. Last session was last Friday. I think they recorded that session too. So inshallah this session we will have a total of three sessions. We'll have, inshallah, three sessions. The first one will start it with Dr. Naim Battikh. Dr. Naim Battikh currently he graduated from University of Homs, went to Hamad, he did residency, and now he finished. He completed his internal medicine residency at Cook County Hospital, and currently he's finishing chief year, and he will be joining Beaumont Hospital for cardiology fellowship. Dr. Naim, if you would like to start.
صباح الخير ويعطيك العافية. Good morning, everybody. Uh, all right, let's. Can I share my slide, Majd?
Yeah, go ahead, Naim.
There's a. Right.
Now you should be okay.
All right. Let's see. Is it showing as a presenter view or?
Yes, it's showing as a presenter view.
All right.
Here we go.
All right. Good morning, everybody. And thank you for joining our workshop. I was asked to give a talk about resources in internal medicine residency, and my talk will be directed to people who are joining the internal medicine residency per se. So I chose this title. I wanted to switch you guys from the surviving mode to thriving mode during your internal medicine to try to make the most out of it. So if you can look at the picture, if you can see my slides, I asked AI to generate an image for a resident, specifically an intern, is studying during his internship. And this is the image I can see. Someone is standing in the middle of the corridor in the hospital, has no time in writing some notes, and just telling you there is no much time to study as before. And then speaking about time and imagination, this is another AI generated image that's telling you kind of how we predict or anticipate the future as an intern or residence. Like someone is with a fresh hair, very ironed clothes, and having the coffee in their hand, and they living the best of their life. And I would just tell you, maybe this is not the case here. Most probably you will end up like me a decade ago. Someone is super tired, has nothing to do except just admitting and discharging patients. This is, by the way, in Mousab hospital back in the day. All right, very quick. My objectives for today, I will talk about the most to have clinical resources, what the resources we usually nowadays recommend for internal medicine residency. I will touch on a study strategy, some strategy. It doesn't mean to follow these strategies, but you might find it helpful. And then I will walk you through a minimal daily routine or how the week should look like. Before that, we know that interns are super busy. And then you might get 10 plus, maybe sometimes patient, and then this talk tailored to your busy life during the internship, how you can save some time for studying. All right, the most important point I want to start with is the mindset shift. You are now an intern, not a medical student anymore, so you need to forget about the volume, about the Harrison or Davidson textbook that takes forever to finish. You need to stay active and read around the clock. And then if you want to take one home message from my talk today, it will be anchoring to your patient. So that's, we'll talk about it later, is a case-based study. So my goal here is just to make you good enough to be safe and then steadily improve. You'll not be the best interns from the first day. All right, let's start with the clinical resources. I think we all agree on UpToDate. It's a gold standard for evidence-based medicine. It has all the pathophysiology, treatment rationale, everything you want, you can find it in UpToDate. But the caveat here in UpToDate is look like you are drinking from a fire hose. You need to know from where and how you read in the UpToDate, because it's time consuming sometimes and you might spend hours with not significant benefit. So we'll talk about some strategies later on. The second most important one, the pocket medicine. This is phenomenal resource. You can have it in your phone or you can have it in your pocket. I got the 3rd edition when early joined residency back in Damascus. And then now there is a 9th edition. Mark Sabatine is a genius. Mentioned with a group of Mass General like residents and fellows, they almost covered every single topic in medicine. Very great resource during the round, before the round, or after the round, in the day at the hospital, if you need a quick algorithm or just to find a kind of information related to your patient. Now, mentioning the resources, of course, MKSAB and you have to have these things. Now, the way how you can tackle these things, MKSAB is your textbook for internal medicine residency. And I can say you have to finish one textbook during the 3 years. 36 months is enough to finish the MKSAB once at least. And it's, by the way, it's a cornerstone for a reason, because your board exams, most of the ideas will come from MKSAB. And I had my board last year, almost covered everything. The U board is not only for information sources, it's just to get you used to the exam style. So you get the habit to get 2 or 5, 10 questions every day from MKSAB or U board around the clock, and then you can make some kind of, building a habit of reading. All right, this is the last thing about the resources, what I would recommend. Core IM, it's a podcast, and Curbsiders are great. I cannot emphasize more in these podcasts how important and how informative are these. The only thing about these are there is a lot of topics inside, and then you might find more than 500 or 600 episodes. I will later talk about how you tailor your study, like protocol or style. You can get some benefit from these podcasts. Now, I have these also extra apps. Most of the residents, they have the MidCal as well. Let's help you just to calculate the scores, etc. You can download it in your phone. Will literally seal the deal. If you want just to anticoagulate patient atrial fibrillation, pulmonary embolism patient to diagnose, Wills criteria, immediately you plug in information, plug out, and that's it. And then you get immediately the result. And that's kind of ease the cognitive load. You do not need to remember anything here. And then the last one is a little bit sophisticated, is called the Hippocrates. I like this app. It's about medication. Some people, they use UpToDate. Some other people use Medscape, but Hippocrates is very up-to-date medication apps. Will help you with finding the interaction, the dosage, etc., etc. Most of the academic center, they have pharmacists with you, so they will help you just figuring out this stuff. But this is kind of an app very helpful to have in your phone. So these the resources that I would recommend. I will move very quick to the strategies, because I think this is the most important thing, how to utilize these resources. I always say work smarter, not longer. And what that means that let your patient set the curriculum. You do not need to open, if you open the Harrison and look at the how many topics in internal medicine, you will get lost. So make sure that your patient will be your curriculum. And I will give you an example of that. So you will have many admissions, let's say on an admission days, pick 1 or 2 or maybe 3 diagnoses. One of them, let's say the DKA patient. That's my style I'm explaining here. You can build your own style. just sharing my thoughts on this. So I get a patient with DKA. I have no single information about DKA except what I learned in the step 2 CK. Immediately, either during the cold day or after hours, go home, open up to date for 10, 15 minutes, just read the summary about the management of DKA. Try to summarize it yourself, write it down. Write it down on an app or in a notebook, whatever. Make your own tweet. And I will keep repeating, make your own tweet, because that's what you will remember almost for the whole entire residency. And then immediately when you write it down, the next day morning, when you are pre-rounding in your patient, you can just try to memorize what you wrote and then confirm that with your notebook. And if you want to go the extra mile, you can also share what you learned with your juniors or your students. Always like you can share it, and then you can make also more benefit and it stick deep in your mind. Why this approach, I feel like kind of a style work very well, because here you are connecting your clinical context, which is your work, your patient. You will always remember Mr. Jones at 2 a.m. in the morning, admitted with DKA, has 28-year-old, and will connect all the information you read, the smell, the lights, the numbers, the words, everything together in your mind. And that's kind of an approach can make these information stick longer. So first advice is patient-driven learning. The second one is the spaced repetition. And then I was reading an article about the spaced repetition. It's kind of the most evidence-based learning technique nowadays. How you can make it, you can kind of utilize Anki or Ankai app. This is a fabulous app. I mean, I cannot emphasize more about having such an app. I will explain about this app later in the Q&A session. But this app, you can download the app and write down your flashcard. Please do not download a pre-made decks. Like you want something, you make yourself, write it down. All right? Do not have the pre-made done. How you fill this app? Usually you will have an encounter and knowledge gap. Absolutely, in the round, there's someone will asking a question you do not know. Maybe what are the beta blockers are proven for survival benefit in heart failure. You might know one, might two, but if you don't, immediately write down your flashcard on Ankai and then immediately start just, get the use of micro session repetition. So you can use this flashcard later on in your phone where you're waiting the elevator or pre-rounding. So the moment you have these flashcards and building up your own learning curve, so you will let the algorithm later on do the rest. What that means, this kind of app will notice how fast you answer the question and when you make it right and when you make it wrong, and they will repeat the question you did it wrong. And that can reinforce the learning process. And my last advice is keep a pair log. My favorite app with a pair log is called Notability, and I use it all the time. I will show you a screenshot of mine. So always there will be an interesting findings or some facts that you didn't know. You round in cardiology, and someone will ask you a question about what the criteria of endocarditis, if Dr. Alyousef is here, and he's so meticulous about the findings. So you do not remember all the stuff, and you do not need to remember every single detail, but it's good to have a tweet or 1, 2, 3, 4 findings in your mind. So if you do not know the main or the dosage of main medication you can use in the floor, heart failure management, COPD, main medication and exacerbation, asthma patient, this is the bread and butter in medicine, you go and write your own summary. And again, you can summarize it from UpToDate or MKSAP. And then the reason why I'm saying, because you will have some lighter days during the week later on, and you can open your notebook and just rehearse. And then that's how the information stick in your mind. This is an example of mine. If you look in the left, I tagged every single organ to the information. This is one of the cardiology things, like let's say one folder about dual antiplatelet in acute coronary syndrome, some guidelines of ACS 2025, heart half-BEF, what the information I do not know about half-BEF. And then every single time, I do not go to UpToDate anymore. I go to my notes and build up more. And then because when you read it once or twice or 3 times, after a while, in 6 months or a year, you will find yourself almost ready for all these topics, especially for the board. All right, let me walk you through a minimal daily routine, how you can implement all these together. So during the day, let's say you are admitting and you have a kind of 3 or 4 or 5 admission, you pick up 1 or 2 main diagnosis, and you go home, or maybe during the hospital, you can open up to date, read 5-10 minutes about the case. Again, your patient is your curriculum. And now after work, you just write down in your notebook 3 or 4 bullet points. That's what I do, like summarize what I read about the thing. And then later on, I rehearse it when I have some time. Now, all of us, either you are driving or you're walking to your hospital, you have some commute time that you can listen to podcasts. Podcast should kind of a passive thing. So go to Curbsider or Core IM, write down, like you are reading about atrial fibrillation, write atrial fibrillation, and you will have an episode about atrial fibrillation. Put your AirPod and then drive to hospital, get most of the episode done, and then back home, you finish the episode of atrial fibrillation. You linked all together, so you are focused your effort on one topic so you can digest it well. So as you can see, it's kind of encoding everything together with the same topic so you can make the most out of it. So weekly structure, I would say, why it's important, because you will see some alternative pattern from day to day. So you are not 100% able to give your energy, your time during the week. There's some days you are super busy. So do not feel regretted or do not feel bad you couldn't read. 5 to 10 minutes a day is absolutely more important than binge reading for once a month or once a year. So building the habit is the most important thing. Now, you will have one lighter day. You can read or rehearse what you wrote about hyponatremia or COPD exacerbation. And then your day off, I would say this is the golden day. I know there's a lot of things you need to do in your day off. You need to exercise, you need to get rest, some socialization, like someone need to do the laundry, other people, they do the grocery. Yes, but I would say save an hour or two fiercely just to make sure that you can read in depth one topic of internal medicine, either heart failure or ACS or whatever. These things will serve you well later on. All right, so there's some techniques about studying. If you are a procrastinator like me, you can do these techniques and will reinforce the information in your mind very well. So the Pomodoro style, I think everyone almost know about this style. It kind of a 20 minutes of isolation, multiple repetition. You go and focus 20 minutes or 25 minutes, get a kind of a 5 minutes break, and then go again the cycle for 1 or 2 cycles every day or every other day. It will make the most of your habit of reading. The second thing, single tasking. The moment you want to start reading, please keep your phone away from your desk. I mean, keep it in the other room. Switch off the EMR, switch everything off, and then make sure that you are to the point what you are reading. And the last thing is very important. That's teach to remember. I always say that's the best way to learn is teaching. The moment you feel like this topic is very difficult and it's complicated, sign up for a quick lecture and just explain it to your colleague. One last thing about evidence. I was asked to talk about evidence. It's very common. It's very important. It's a tool. Utilize it, use it, but know how to use it, because this is kind of an assistant tool. If you ask wrongly, it will answer the wrong question. So this is the evidence-based way to ask about evidence. Always mention the BICO protocol. TTS is the timing, the type of study you want, the time frame, the type of study, and also the BICO population intervention outcomes. I do not have much time to explain more details about that, but I'm more than happy to take more questions later on. So my key take homes here, intern is the marathon. It's not a sprint. It's not about knowledge in wide knowledge. It's about how you learn during your year. And then also the habit you build the first 6 months will define you on how you will learn in the rest of your residency and maybe Bayan. And then also forget long study sessions. Take textbook. This is not the solution here. Most effective interns learn in the flow of the work during admission, discharges. So always anchor your learning to your patient. So your patient is your curriculum. Prioritize consistency. As I said, 10 minutes every day, better than binge reading every other month. And then use active recall, your own cue banks, build your own flashcards and rehearse it, and protect recovery. You need to take care of yourself, the well-being. You need to sleep well. You need to socialize, eat a very good kebab here in Chicago. Oh, that's great. Thank you so much. That's it. I'm not sure if on time. More than happy to take any question for this information. And thank you again.
Perfect. Thank you so much, Naim. Thank you so much. That was excellent. And I was gonna ask you, like at the end, are you gonna talk about open evidence or not?
Absolutely.
Yeah,
If I have
beautiful.
some, yeah, if I
Yeah,
have
yeah,
some time later on, because it's
yeah.
it's very common. Everybody is utilizing it, but it's a tool and it's a system tool. It's not
Right.
something you can substitute you in the clinical setting.
100%, 100%. Thank you. It was
Yeah.
excellent presentation. Thank you so much. Next, we will have Dr. Tareq Alyousef. He will talk about, he will emphasize on the mentorship during residency for the applicants that we have with us that they don't know Dr. Tareq Alyousef. Dr. Tareq Alyousef, he is one of the founders of SAMS Educational Committee. He was my go-to when I was applying for residency, when I was applying for cardiology. He did not believe that I'm applying for EP until I applied and I matched. I'm graduating now, actually. So Dr. Tareq Youssef, he is the chief of cardiology at Cook County Hospital. He did all of his training, residency, chief resident, fellowship, cardiology at Cook County. He did interventional at University of Nebraska. Currently, he's the chief of cardiology. He's the director of CCU at Cook County Hospital. Dr. Tareq Youssef, thank you so much for joining us and for your time, and it's all yours.
Good morning. Thank you, Majid, for the nice introduction. And thank you, Naim, for a great, as usual, lecture. Congratulations to the applicants who now became residents and interns. You should be proud of yourself. I think you need to, you're about to become something that every child probably in the world dreamed about becoming one day. Everybody at some point of their lives wanted to become a doctor. And now you're on the verge of becoming one. So be proud of yourself. I was asked to talk about mentorship. I'm going to try to share my slides. Let me know if you can see them. Are you able to see?
Yes.
So mentorship with a question mark, because I'm going to try to convince you that at the end of this talk, there's going to be a little twist that I don't think any of you is going to be necessarily looking just for mentorship. There's something more that you're looking for that you should look for. What Naim just did is I would say, a mini mentorship. Those 15 minutes literally summarize probably something that's going to take you months, if not years, to discover. Summarize it for you in less than 15 minutes. Imagine you have somebody like this in your program who does this with you every 3 to 4 months to build you up, help you become the person who you want to be, the kind of doctor you want to be. So what is a mentorship? It's a developmental relationship in which a more experienced person who went probably through your same pathway helps a less experienced person grow over time by offering guidance, perspective, support, challenge, and access to opportunities. I do want you to differentiate between those terms and try to identify when you start your residency, who do you want to do what? So your mentor is somebody who's gonna answer the question of who are you gonna become in 10 years? What is the final product looking like in 10 years, 15 years from today? What kind of doctor you are? Long-term project that develops a person over time. Coaching is an improvement, somebody who helps you to improve a specific skill or a performance domain. It's usually short, focused, goal-directed, practice-based approach. And the answer there, the thing they're trying to help you do is how can you perform this better? They will literally walk you through step by step over time on a specific task. It is task-oriented. We noticed that you don't know how to talk to patients. Okay, let me focus on that. How to make you talk to patients. As you can see, mentor is more of a philosophy. In the big picture, and after 15 years from today, how are you going to look like? How do you think? How do you approach research? How do you approach clinical work? The depth of your knowledge, the depth of your analysis, and so on and so forth. Feedback and evaluations are two things actually that are very related to each other. Usually a feedback is at the end of the rotation, a shift. Somebody will tell you, what did you do right? What did you do wrong? It's not their job to tell you how to improve on this. This is going to be 90% of your interactions when it comes to feedback programs wise. The evaluator actually is taking that feedback and saying, did you actually cross the bar? Did you achieve what you're supposed to achieve, or did you not? Are you competent or are you not competent? So it's a judgmental, it's very, very judgmental. Those are actually the majority of your time. We're going to hear one of those terms when it comes to between mentorship, somebody who's an advisor, somebody who's an evaluator, and somebody who's a coach. I wanted you to be aware of those. You're going to need all of this. The programs, I think all of them are going to give you feedback and evaluation. Some of them are going to give you coach, and very rarely they will give you mentorship, I would say, unless you actively seek mentorship. Now, the feedback tells the residents how they performed. Coaching helps them perform better. Evaluation decides whether they met the standard, and mentorship helps them become the physician they are capable of becoming. So the mentorship focuses on professional identity, career direction, confidence, values, navigating institutional culture, research and academia development, work-life balance, resilience, and long-term growth. Those are the major domains of mentorship. You want somebody, if you can, to walk you through those, because it's going to be very difficult for you to figure out those things yourself on the long term. In residency, attendings often serve multiple roles at once. They are teachers, they are evaluators, coaches, and mentors. And that creates a real tension, to be honest. The residents might not be fully disclosing their weaknesses to somebody who controls their evaluation. And that is the tricky part of this part, that a lot of people approach mentors who are actually going to evaluate you one way or the other. And that's problematic in so many ways, because mentorship is all about building trust over time. You should be able to tell your mentor that you're bad at 1, 2, 3, and you want help with 3, 4, 5, and so on and so forth. The limitation to that is, but if they are the ones who are actually working with you during rotations, CCU, ICU, floors, and so on and so forth, now we become quite exposed. And that actually is going to go into your evaluations, which is not a great thing. That's why actually people unconsciously end up asking for mentorship from people who have nothing to do with their clinical work for the most part. Research, projects, because they, again, unconsciously, I don't think people realize why mentorship is almost always hooked to research for the most part. It's because the researcher, chances are, he's somebody who's truly interested in something that has nothing to do with your clinical life. It's mostly science and how to do papers and how to finish projects and teamwork and so on and so forth. So you'll be able to tell them what you should tell them for them to become effective mentors, which are your weaknesses, your struggles, so they can guide you out, as opposed to your floor attendings who you're going to be under the microscope for them. And if one of them is your mentor, it's going to be a little tricky. You're going to have to be very socially smart to know how to navigate through that. So what do residents need during their training? Do they need feedback? Do they need coaching, mentorship, or sponsorship? I would say early in training, residents need more feedback and coaching. This is you trying to survive. You have to have some insight that you're not the gift of heavens, no matter how good you are. You're not the gift of heavens to that place. And you're going to have a lot of flaws, and you want somebody to give you feedback, very like on small things, filling the gaps for your issues. Later in training, when you're a second, a third year, it is increasingly important to find a mentor, somebody who can help you figure out who you are. To make this a little more blunt, honest, and more complex, if you also are a struggling resident, a struggling intern, you need more feedback and coaching. You don't need mentorship. Mentorship comes when you figure out, the basics and you're doing okay, you're on autopilot. and now you want to push things to the next level and figure out your philosophy of life and who you want to become. During internship, usually feedback and coaching is the most important part of your evaluations and kind of feedback. You're trying to survive. How do I present clearly? How do I manage time? How do I write notes efficiently? How do I recognize sick versus non-sick? How do I call consults? How to avoid dangerous mistakes? So an intern who cannot organize a patient presentation does not need a philosophical conversation about career identity. They need someone to watch them, correct them, and coach them. For senior residents, now you're trying to answer some different questions, assuming you covered your basics, which is what we discussed on the previous slide. Now you're looking for, what kind of doctor am I becoming? Am I pursuing a fellowship? Am I actually good at it? What are my strengths? What kind of environment fits me? How do I lead interns and students? How do I handle conflict, uncertainty, responsibility, and so on and so forth? This is where mentorship becomes essential. It's not an option. It's not a luxury. It is essential if you want to truly become the best version of yourself. Without it, a resident may become clinically competent, and you see a lot of those, but still professionally immature and directionless, very emotional. Any conflict makes them start shouting and fighting, and the maturity is lacking for the most part. So I'll tell you in actually the next few slides how to start a mentorship relationship in 7 simple steps. First, you have to become observable. And that is, I'm going to go over this and what does that mean? You have to find something that that makes you observable. Second, you build a small mentorship map. You do not look for one mentor. Third, you strategically choose a main mentor for yourself. Fourth, approach that mentor or mentors, depending on the environment. Fifth, prepare for your first meeting and every meeting afterwards. But the first meeting is the most important meeting. 6, maintain the relationship. And 7, transform the mentorship into where I just started this talk. Something that I'm going to expose to you in a minute, which is what you guys are looking for without knowing. So first, become observable. For the first 6 months, you should focus on being reliable, showing up prepared, responding to feedback without defensiveness. 0. No pushback. You take and say, okay, I'll work on this. Asking thoughtful questions, being kind to nurses, coordinators, and peers, genuinely kind. Not the kind of person where the nurses are saying something bad in your back. When you're just smiling in front of attendings and saying something bad when the attendings are not there. Avoid gossiping and complaining too early. You will gossip and complain. Just keep it to your second year. Learning the local workflow. Attendings are most likely to invest in residents who seem serious, humble, dependable, and coachable. Now, step number 2, after you achieve that, you're going to build a small mentorship map. And that, I'm going to give you examples here. How to survive residency. Who's going to be your coach for that? Probably a chief resident is your best choice. How to understand the hospital culture. Who is your best choice? A trusted faculty or a program leadership, associate program director, core faculty. Clinical reasoning, you find a strong clinical teacher. Career planning, faculty in the desired field. So now we go to the subspecialties. If you're now looking for, I know I'm going to do cardiology and I want to plan my life, start looking for a cardiology mentor. Research, obviously you want a productive academic faculty with good ethics of work. And I'm going to come probably briefly into this shortly. Fellowship strategy, a faculty with credibility in that specialty. Personal adjustments as an IMG. You want another IMG faculty or senior resident who has succeeded. You want to talk to them, listen to their experience, and see what you can learn from them. So that's your map. Now you go to strategically choosing a mentor. What should you be looking for? You're going to look for 4 qualities in your mentor. 1, he's competent or she is. The attending should be clinically respected. No doubts about his clinical acumen or her clinical acumen. A nice but weak mentor may be emotionally supportive, but strategically useless. Why? Because at some point you're going to need that mentor to say something good about you. And if nobody buys his word or her word for a penny, that's useless. That's a waste of your time. Availability. A famous attending who never responds is not a functional mentor. Don't go and choose, you're still in your first year and go to, I don't know, the most busy guy in the hospital and tell them to mentor you. Choose something a little more, somebody who's a little more available. Third, integrity. The resident needs someone who gives honest advice, not someone who uses residents for labor, politics, or ego. This is very valid specifically for research. Somebody who uses you to collect data and so on and so forth and ends up actually not supporting you with a letter or with opening doors for you is not a real mentor. And the fourth is the institutional knowledge. Especially, this is very valid and important, especially for the IMGs. The mentor should understand how the local system actually works when it comes to evaluations, fellowships, applications, and so on and so forth. The best mentor is not always the friendliest. Sometimes the best mentor is the person who is fair, direct, and invested in your growth. Fourth step is approach the mentor. What can you do bad? Can you mentor me? Terrible. The way you do it, a better version is, I'm interested in cardiology, but I know I am early. I would value your advice on what I should focus on during intern year to become a strong applicant later. That's okay. That's a good version. A better version, kind of a perfect version is, Dr. Smith, I appreciate your teaching on rounds, which actually comes back to the first point, that visibility. You did something during rounds and you got some good feedback. Now you go and you say, I appreciated your teaching on rounds. I'm new to the US residency system and trying to understand how to build a strong clinical habit early. Would you be willing to meet for 15 to 20 minutes so I can ask for your advice? That is great. The key is you have to be specific, respectful to the time and the expertise, low burden, and growth oriented. Cannot take a whole hour from the person's name. Time. Prepare for your first meeting. That should be come by, like, do not begin by asking for letters, research, or favors just because you did well all rounds. That is too transactional. Better first questions are, what do strong interns do differently in this program? What mistakes do new residents commonly make here? How can I build a good reputation early? How should I focus? What should I focus on in the next few months? How do I know if I'm progressing appropriately? And last question is a very important one. Would it be okay if I checked with you again in a few months? Remember, it's a relationship, and you're the one who's driving that relationship. They are not going to get excited. They're not going to chase you. It doesn't matter for them whether you want their mentorship or not. So it's on you to throw that question at the end of each meeting. Now, step number 6 is to maintain the relationship. This fails when the mentee is passive. The resident should follow up after the meeting. Write a thank you email, something like, thank you for meeting with me. I took your advice seriously. I'm focusing on improving my presentation and anticipating overnight issues. I'll update you in a few months. In 2 to 3 months, you literally go and tell in an email that I wanted to update you. Your advice has helped. I've been working on shorter presentations, blah, blah, blah. So you follow up, you close the loop on what you promised on. This is how the mentorship grows. And there's that should bring evidence of effort. Every now and then you show updates on projects that you've been assigned and so on and so forth. Now, the last step is to transfer the mentorship to the magic word. And you remember this slide that I kind of hit something there. I do want to show you what is actually what majority of you guys are looking for. You're not looking only, or should not be looking only for mentorship. Should be looking for something called sponsorship. Now, you earn sponsorship when faculty can comfortably say, I know this person's work, I trust their judgment, I'm willing to attach my name to them. And that's only after they mentor you and they believe in you. For an IMG, sponsorship usually requires three things: reliable clinical performance. You have to be reliability is going to be the theme in this presentation. It's all about how reliable. Can I trust that this guy is going to take things to the? Can I trust that he's going to tell me when he's not able to do something? So reliability, visible professionalism, and repeated contact with credible faculty. So the mentor can eventually become your sponsor, but that's going to take a long time. A mentor would speak with you. A sponsor speaks about you when you are not in the room. He would defend you when something comes out from a nurse who's angry with you, and so on and so forth. A mentor may help a resident prepare for a fellowship, may call a fellowship director and say, you should seriously consider this person, and so on and so forth. Let me briefly just say a few words about what you can do to screw this one up. Ask for mentorship before showing reliability. Treat mentorship as a shortcut to opportunity. Follow the pattern of ask the letter, disappear. For a letter of recommendation, disappear. Ask for research, disappear. Don't follow through on your projects. Respond poorly to criticism, which means actually be defensive. Confuse vulnerability with dumping. Mature vulnerability is I'm having difficulty adjusting to the pace and documentation expectation. I'm working on it, and I would appreciate your advice. Dumping is this program is disorganized, everyone is unfair, I'm overwhelmed, nobody helps me, and I don't know if I belong here. Gossiping is a no-no. Seek only powerful mentors is a no-no. Choose mentors based on their friendliness is a no-no. And hide your weaknesses until they become public, and be passive. Those are some of the things that you can do to really screw that relationship. So I'm going to leave you with my only take-home point from this, which is it's a relationship, and it's also an investment from the mentor's perspective. Residents damage the mentorship chances when they appear unreliable, passive, or transactional, or defensive, or politically unaware, or careless with opportunities. And the best mentees earn is the major word here. Mentorship by being coachable, prepared, respectful to time, and visibly approached by advice. Best of luck, guys.
Thank you, Dr. Tareq. That was excellent. Thank you so much. I cannot emphasize enough on the mentorship and the importance of the mentorship, especially if you guys are planning to pursue a fellowship after your residency. As Dr. Alyousef mentioned, he like your mentor, he's not your friend. You should not treat him or her as your friend. But in the future, they will be your friend if you keep a professional relationship with them. I still have a professional relationship with my mentor since I was a first year resident. And I still text them, and they will text me back about stuff not related to my questions about mentorship anymore. I will stop here, and I will switch gears to talk about research planning during residency. I will have Dr. Bakri Hammami. Dr. Bakri Hammami, he graduated from University of Sharqa. He joined Albert Einstein for internal medicine, and currently he is a hematology oncology fellow at University of South Florida in Tampa. Dr. Bakri Hammami, it's all yours.
Assalamu alaikum. Let me share real quick. Okay. Should be good. So, okay, everyone. So, I'm Mohammad Bakri Hammami, hematology oncology fellow من حاليا بموفيت Cancer Center. Thank you for the introduction. أنا فعلا graduated من جامعة الشارقة. لما جيت على أمريكا أول شيء I did research. I was a research fellow بمايو كلينيك. بعدين عملت residency بجاكوبي بألبرت أينشتاين بنيويورك. Currently University of South Florida بعمل هيمونك. I still am a research collaborator مع Mayo Clinic. The topic that I'm going to talk about is research بالresidency. I'll try to keep it general لكل specialties, and I'll try to keep it practical as well as much as possible. So I guess one main question that we have طبعا نحن كلياتنا جايين من أماكن مختلفة. في ناس جاية من سوريا، ناس جاية من بلدان تانية. So our experience with research is very different. بأمريكا what we need to know is research is an integral part of الcurriculum. أساسا هو part من ال ACGME requirements إنه يكون في scholarly activities للresidents. بس it's not just a requirement، في كمان كثير benefits حتى الواحد يشتغل بالريسيرش بأمريكا. Obviously all of you know إنه it's important for the match، بس هذا first match هلا بالنسبة لكم اللي هو residency. في لسه اللي هو الماتش الثاني اللي هو الفellowship للي بده يعمل fellowship، وفي اللي هو الماتش تبع الجوبز اللي بده يعمل يشتغل بacademic jobs and other jobs as well. So why is research important? I guess I can summarize it ب5 أشياء أساسية that was important to me, and I think really important for a lot of people. أول شيء الفellowship. I would say 90% of fellowships require some form of scholarly activities بالفيلد اللي هن فيه، وخصوصي في بعض الفellowships that require even much more scholarly activities. منهم الفيلد اللي أنا فيه اللي هو oncology. بس also cardiology, GI, pancreas. دول كلهم fields what would differentiate you from other people beyond other things اللي هن obviously letters وكذا اللي هو الريسيرش اللي تشتغله بالfield itself. The other thing is that it offers you a road to permanent residency, and that's the road that I took. حتى انتوا كلكم نحن كلنا بنبلش او اغلبنا ببلش على فيزا and then بدك تحول فيزا لجرين كارد at some point. في اكثر من طريقه، بس واحده من الطرق هو عن طريق الريسيرش. If you accumulate enough research خلال الريزدنسي قبل الريزدنسي بعد الريزدنسي you can actually apply for the green card through الريسيرش work اللي انت اشتغلت عليه. ما حتفصل فيه كثير، بس obviously you can ask me later كيف الواحد ممكن يشتغل على هذا الموضوع. academic and industry career، حتى اللي ما بده يشتغل بالفellowship، إذا بس بدك تشتغل university as a hospitalist أو as a pediatrician أو whatever. كمان الuniversities بتطلب منك scholarly activities. الاندستري اللي هي المقصود فيها الفارما companies. في كتير فارما companies بتخليك تشتغل كadvisor ل clinical trials وكذا. Obviously they require research. بفيدها كثير بموضوع السوفت سكيلز ديفلوبمنت. هي شغله يعني مفروغ منها. تيم وورك، الليدرشيب، القصص هي كلها. في اشياء كثير ما بتتعلمها بالريزدنسي itself او بتتعلمها، بس يعني it's much more complemented بالريسيرش. وفاينلي يعني the end point of all of this اللي هو مرات كثير بننساه، انه بالاخير نحن what we're doing is to improve patient care. So لما انت تشتغل على ريسيرش معين، لما you're reporting a particular case او case series او كذا، بالاخير انت يعني عم تستفيد من هي، لانه الكيس اللي انت reporting someone else صارت معه بمكان ثاني. they can use their experience. وهذا اللي نحن كثير هلا انتم بالريزدنسي حتمر عليكم cases that are very weird. حتدور على جوجل حتلاقي حدا بالصين كاتب عليها كيس من قبل كيف عالجوه وكذا. So at the end of the day research is important to improve patient care. What are the expected outcomes؟ يعني نحن لما نقول research شو عم نحكي نحن؟ شو النتائج اللي بدنا نطلع منها خلال الريزدنسي؟ I would say انه main things that come to mind هي conference abstracts، انه يكون في عندك abstract منشوره بconference whether you present later on as a poster أو presentation. المهم إنه يكون في عندك abstract بconference. That's I would say it's an outcome, meaning it proves إنه أنت اشتغلت الشغل اللي أنت عم تحكي إنك اشتغلته. يعني أنت لما تقدم على fellowship وتحكي إنه أنا اشتغلت research I don't know باللوكيميا. طيب where's the evidence? The evidence either abstract بconference, poster presentation بconference, presentation oral presentation بconference whether it's local يعني بالمستشفى تبعك أو regional بالمنطقة تبعك بفلوريدا مثلا أو بتكساس، أو national يعني conference كبير. والأهم من هذا كله اللي أنا I think إنه we all should strive to achieve هو peer reviewed manuscripts. يعني إنه بالأخير أنت عملت البروجكت، عملت له poster presentation whatever, that's nice, it proves your work. بس هذا ما بقوة إنه يكون في عندك peer reviewed manuscript. وهي شغلة كثير بيركزوا عليها بعض الفيلوشيبس منهم اللي هي مونك، إنه أنت ما بيحبوا هن واحد عنده كثير abstracts أو كثير posters ما عنده ولا paper. هذا معناه إنه شخص ببلش البروجكت بيعمل عليه abstract وبس بيوقف خلاص. you know بالأخير I always think about an abstract أو a poster as a road للمانuscript اللي بالأخير لازم تطلع فيه. So those are the expected outcomes. التايملاين of research هلا راح نحكي عن كل نقطة من هدول in more details، بس I would say هي الرود ماب that I think about لما أنا بلشت residency. و that's what I think كثير عالم من اللي I saw were successful قبلي وبعدي مشيوا عليها. راح تختلف الرود ماب لأنه نحن again as I was saying يعني نحن جايين من أماكن مختلفة. في ناس جاي، أنا مثلا أنا جاي كنت already عندي research experience بالجامعة وبعد الجامعة قبل الريزدنسي. في ناس جايين وما عندهم أي research experience بالمرة، وفي ناس جايين و already عندهم PhD. So الناس مختلفة ب where they start ومختلفة كمان بأنه هل هن متعودين على شغل معين، متعودين بيعرفوا منتور معين، بيعرفوا شخص معين. So بس I think إنه general rule أو general map is I would say almost the same for everyone، اللي هي بتتلخص بأنه أول 3 شهور survive. يعني انه انت احنا مبلشين ريزدنسي، احنا جايين على بلد جديد، ما لنا مشتغلين بهالانفايرمنت من قبل، يمكن عاملين شهر ولا شهرين elective بس it's very different from the residency. So I always say انه باول شهرين 3 probably الواحد لازم بس يركز على how to survive بالريزدنسي. بعدين try to develop an interest, and by interest I mean يعني field معين، يعني مثلا cardiology, GI, hemonc, geriatrics, whatever. يعني طبعا هي try to develop it doesn't always happen. بعدين while you're doing that prepare your research toolkit. يعني كمان وانت عم تحاول to develop an interest بدك يكون عندك minimum requirements لحتى تبلش research. في minimum requirements هنحكي عليهم. Identify the right mentors. الدكتور طارق أعطانا good introduction about mentorship. أنا ححكي شوي أكثر عن ال research part of it. Identify a successful project وبعدين deliver on your projects as the final thing بالtimeline of research. So how do we develop an interest؟ يعني هلا نحن رح نبلش، خصوصي اللي هن رح يبلشوا شيء مثل مثلا internal medicine أو pediatrics اللي هي كثير wide fields compared لمثلا I would say مثلا neurology أو surgery اللي هي مثلا الفيلدز فيها شوي أضيق. يعني الطريقة الوحيدة إنه الواحد، هلا في ناس تجي وهي already they know what they want to do، عملوها من قبل. مثلا قبل الريزدنسي كانوا يعمل سنة ريسيرش بالكارديولوجي و they already know that they want to do cardiology. fantastic. بس ال vast majority of people ما بيعرفوا شو الانترست تبعهم بأول فترة. I think الشغلات اللي بتخلي الواحد يكون عنده interest، هلا نحن بيكون عندنا شوية bias مثلا من الجامعة إنه أنا عملت منيح بالجي اي يعني rotations بالجامعة probably GI. بس خلال الريزدنسي what really helps هو موضوع انك انت تبلش الشغل، تبلش الروتيشنز، تعمل كلينكس، تعمل electives، تشوف patients. I think that's the most important thing. تشوف patients من اكثر من فيلد وتشوف انت شو بتميل اكثر. that's easier said than done. يعني انا عم بحكي بطريقه سهله. بس انا باول 6 شهور انا كنت بفكر انه بدي بومكريت pulmonology و critical care لانه شفت patients وحبيت الشغل معهم وحبيت هيك الارجنسي بالاي سي يو. لكن اللي كان صاير انه بس انا ما كنت لسه عامل الروتيشن تبع الانكولوجي. لما عملت الريسيرش لما عملت الروتيشن تبع الانكولوجي I like the patients more. And that goes on for any other field. يعني بالاخير كل ما شفت patients اكثر كل ما عرفت where do you want to be. ومرات بتشوف كل البيشنتس وبتحس انه you relate لكل هالفيلد هاي، وبالاخر you don't have to develop a field in particular. يعني ممكن تطلع بالاخر hospitalist and that's totally fine. بس إذا بدك أنت if you're thinking about إنه subspecializing I would say إنه preferable إذا بتقدر إنه by mid first year تكون already يعني حددت شوي at least وين المين فيلد تبعك. ليش هذا مهم؟ لأنه نحن الوقت عنا خصوصي بالinternal medicine والبيدياتريكس حتى الوقت لحتى تقدم على فيلوشيب بسيط ما هو طويل. أنت بتقدم بنهاية السنة الثانية، فبيكون عندك تقريبا سنة أو سنة ونص technically لحتى إنك تشتغل، وبدك تشتغل على again مثل ما حكينا abstract papers. حكوا قبل على الموضوع letters، على موضوع المنتورز، على هالمواضيع كلها. ففي شغلات كثيرة بدك تكون عندك by the end of second year إذا أنت بدك تقدم دغري يعني. وكثير منا محكومين بالفيزا فبنحتاج إنه نقدم بسرعة. صارت من قبل انه ناس اختارت وبعدين غيرت definitely again that's a personal experience. في ناس غيرت الانترست تبعه وفي ناس غيرتها يعني اخر شيء يعني by second or third year that's totally fine. المشكله بس انه انت لما تكون بفيلد شوي competitive تحتاج تشتغل فتره اطول فيه. بس اذا مثلا انا كنت بدي كارديولوجي وبعدين حولت مثلا على endocrine ما عندهم نفس الريكويرمنتس تبع الكارديولوجي سو ما عندي مشكله. بس بالعكس ممكن يكون في اشكاليه بموضوع الوقت. واخر شيء اللي هو هي حنحكي عليها بعد شوي، انه don't tie yourself to large projects if you're still exploring. يعني اذا انت لسه ما بتعرف الفيلد تبعك، ما بنصحك تبلش بروجكت من الصفر بشغله يعني يمكن او يمكن ما تكون يعني كثير into it. I would say انه اذا بدك تشتغل بالريسيرش وانت لسه ما بتعرف الفيلد تبعك، بلش بشغلات صغيره مثل كيس سيريز، مثل small retrospective studies، شغلات مثل هي. هلا كنا بنحكي عن prepare your research toolkit، يعني انه انت يكون عندك البيسك requirements تبع الريسيرش. طب شو هن البيسك requirements؟ الشغلات اللي هي الاساسيه. I would say هي الشغلات اللي هي يعني انت لو عندك اياها انت بتكون جاهز 100% لتبلش ريسيرش. doesn't mean انه لازم يكونوا كلهم عندك، لانه في ناس يعني بتتعلمها on the way، يعني بتبلش بروجكت تتعلم هالشغلات هي. بس اذا عندك هالشغلات من قبل ما تبلش I would say that's fantastic. اهم واحده من الشغلات المهمه هي CIPI training. هي مثل national requirement للريسيرش بأكثر من جامعة كثير بيستخدموها. هن مثل online modules، كل جامعة بيكون في عندها required modules كلهم تحت هذا CITI. وكل جامعة في لها بروفايل بهذا CITI، وبتقول لك إنه أنت حتى تشتغل عندي ريسيرش بدك يكون عندك هذا الموديول وهذا الموديول وهذا الموديول. It's very easy again online modules تعملهم، بتشوف فيديوز وبتحلل هي. فأي شغلة you can knock it out as soon as possible. لأنه بتحتاج إنك تسجل على الموقع، ومرات الجامعة لازم تعمل لك approval على الموقع، وبتاخذ وقت يعني شوي. فأول ما تبلش بالريزدنسي اسأل على هالموضوع، شوف إذا في عندهم CITI requirement. الشغلة الثانية familiarize yourself with a statistical analysis tool. هي not a requirement, I would say more to save time. ليش؟ نحن كلاتنا لحتى نفهم ريسيرش، لحتى نقرا abstracts وبوسترز وريسيرش، لازم يكون في عندنا فهم بسيط لشغلات اساسيه. يعني مثلا شو يعني survival analysis، شو يعني progression free survival، شو يعني overall survival. هي الشغلات الاساسيه اي حدا بده يشتغل بالريسيرش لازم يكون فاهم، يعني على الاقل عنده فكره عنها. آم، إذا أنت كان عندك لسه أكثر basics of statistics، يعني كيف تعمل أنت chi square test، كيف تعمل أنت t test، كيف تعمل اللي هي basic comparisons between two groups على أي application كان SPSS R Stata، كل هالapplications اللي بيفيدك إنه you save time، إنه ما بتحتاج تروح عن طريق statistician، اللي هو مرات تكون institution عندك statistician، مرات لا، مرات في حد عندك حدا بالتيم بيعرف يعمل statistics، مرات لا. وفي فيديوهات على النت مليان على موضوع statistics. So it's probably not very hard to familiarize yourself. الشغلة الثالثة اللي هو reference manager tool. I think this is important for everyone. في كتير tools لحتى تعمل references، زوتيرو، EndNote، مانديلي. بس تحتاج بس تتعلم على واحد. Almost all of them work the same way. أنا بستخدم EndNote بس لأنه كل institution كنت فيها كان في license، هو بمصاري، بس institution مرات بيكون في عندهم license. data collection tool كلها بنعرف نستخدم اكسل، بس في institutions تستخدم RedCap which is also important. Understand your institution's IRB process. راح تدخل انت اي project that is اكبر من small case series راح يحتاج IRB. مرات البروجكت already في عنده IRB من قبل، مرات لا. لازم تفهم انت كيف التقديم عليه وقديش بيطول وهالقصص هي. Usually you can do it by talking للresearch people عندك بالinstitution. وfinally utilize your library resources. كل جامعة، خصوصي للي عندهم جامعات، مشافي بجامعات، وحتى للي sometimes the community hospitals مرات بيكونوا ملحقين بجامعة، بيكون في library وبيكون في عندهم كتير resources لها علاقة ب systematic reviews و meta analysis. I would definitely visit الويب سايت تبع اللايبرري وشوف شو عندهم toolkits. Identify the right research mentors. So حكى عنها الدكتور طارق، أنا حكي عنها very briefly. Successful mentors للريسيرش، يعني ناس مشتغلين مع residents من قبل، مشتغلين well. يعني أنت حكيت مع الريزيدنتس وقالوا لك إنه هذا الزلمة مشتغل ومعلمنا كيف نشتغل. هي شغلة مهمة. الشغلة الثانية عندهم track record of publications، يعني مشتغل وطالع معه نتائج، مو واحد آخر publication تبعه من 2016 وهلا بدك تشتغل معه ريسيرش. هدول بكون عندهم يعني they might be good people للكارير بس مو للريسيرش. I wouldn't go للناس اللي الموست سينيور، يعني اللي هن اكثر ناس شغيله بالريسيرش، لان هدول بيكونوا بيزي وما عندهم وقت لحتى يعملوا لك منتورشيب. ولا الموست جونيور بالانستتيوشن، لانه هدول الناس اجين لسه بيكون يعني الناس اللي هن لسه هلا تخرج مثلا ما بكون عنده اكسبيرينس كثير. اذا انت identified هذا الشخص I would introduce myself early، يعني ببعث له ايميل انه دكتور انا، وشورت ايميل، يعني انه انا resident interested بهالفيلد بدي اشتغل معك. بونus points اذا عندك يعني project معين in mind و you want to go for it, that's fine. بس doesn't have to be. مرات كثير هنا بكون عندهم ideas و they come with it. اذا ما رد عليك بالايميل، انا مرات كثير كنت اروح دق بابهم وروح لعندهم يعني. و that's fine يعني in most cases. try انه بس انه identify المنتور، انه يكون عندك regular meetings، مع انه مثلا كل شهرين ثلاثه you check in with them. خلص قل له انت منتور تبعي، بدي كل شهر نقعد ميتنج او كل اسبوعين او whatever يعني. you come up with a plan مع المنتور تبعك. اذا ما كتير بتعرف انه هذا المنتور هو يعني راح يكون البست منتور او ما حدا مجربه من قبل، ممكن تبلش معه بشيء صغير يعني. again case series, small retrospective study, already data جايبينها وكذا. project كبير بس انه already مجمعين كل شيء بس بدهم paper something like that يعني، بس to assess the compatibility وبعدين تبلش معه بشغلات كبيرة. something very important, a research mentor may or may not be the best clinical or career mentor يعني. اللي عم تشتغل معه بالريسيرش ممكن ما يكون أحسن حدا يعطيك clinical advice أو career advice. بدك ومرات they can be the same يعني. بس بدك تكون very specific. Again, you can refer back to Dr. Tareq's lecture. Then
بكري دكتور بكري، الله يعطيك العافية، بس
طولنا.
we are way behind our schedule.
طيب
So
خلص.
I will let you talk about this briefly during our session, talk about like preparing for fellowship. I will give the audience like 2 minutes break, or 2 minutes, like we'll start at 11:05 Eastern time, like after 1 minute actually. So
تمام
we will talk more about research if you don't mind.
تمام.
Thank you so much, guys. Like, let's have 1 minute break, a water break, and we will be back, inshallah. Don't go anywhere, okay? All right. So we will continue with our session as scheduled. Thank you so much, Dr. Bakri. It was excellent presentation. And correct me if I'm wrong. You, did we do at some point the were you like did you attend the prepare like workshop bootcamp for residency at some point a few years ago?
I don't think so. I don't
Okay.
think so.
Okay. Then I'm mistaken probably with someone else. الله يعطيك العافية ما شاء الله. You have an excellent background research experience, and you implemented that in your lecture. Unfortunately, like we have limited time, so inshallah we'll talk about research during our session now. For people who joined us lately, actually, I did not introduce myself properly when we started. My name is Majd Jazaerly, and من دمشق. I started medical school in Syria. I graduated from Xavier University. I did research here at the Brigham and Women. I did my internal medicine residency, and I was chief resident at USF, University of South Florida. I completed my cardiology fellowship at University of Miami, and I was chief fellow too. Currently, I'm putting the final touch on my electrophysiology fellowship at university. I'm chief fellow also at University of Rochester in New York, and I will move to Chicago, inshallah, to join Franciscan Health to be cardiac electrophysiologist there. We've been doing this for the last years. I was one of applicant at some point. I was one of the people that attended the residency bootcamp at some point. All of you guys are welcome to join us in the future, and I'm sure that some of you, and if you want, like all of you, can be part of this workshop in the future. We will discuss now the fellowship and career planning panel. We also had a series of competitive fellowship planning. It is on our I think YouTube channel, SAMS Educational Committee YouTube channel. And like I was talking to one of my friends, he's Egyptian, yesterday. He's a second year GI fellow. So I was talking to him, and he told me that he listened and he gained a lot of information from our how to get into GI fellowship actually. So I advise all of you guys. It's kind of like early now, but it's always good to, especially if you know what you want to do after residency. So for the fellowship and career planning panel, I will be the moderator. I will have Dr. Maya Sufyan. She is currently a pulmonary fellow at Cincinnati Children's Hospital. She did her residency and chief resident, and she was chief resident at Beaumont Hospital. I will have also Dr. Bakri Hammami. He just gave us a presentation about uh, research planning. Dr. Tareq Alyousef, you are welcome to give any comments at any time during the session. The session, inshallah, will be from now until like 10 p.m. Central, 10 a.m. Central Time, 11 a.m. So about like 45 minutes or 50 minutes from now. If you guys have any question, please submit your question through the text or raise your hand and we will take them simultaneously. I will start with Dr. Maya. Dr. Maya, I know that you are now a pulmonary fellow at Cincinnati Hospital. When did you decide that you want to do pulmonary fellowship? Was it before residency, during residency, and if during residency, which year? First year, second year, or third year? So I'll start with you, Dr. Maya. I think I saw her. Unfortunately, probably we lost Dr. Maya at some point. So, okay. I will switch the question to Dr. Bakri. Bakri, when did you decide to do a hematology oncology fellowship? Was it like, because I know that you have a research background. Personally, I had a research background at Brigham and Women because I got like, I graduated from the medical school and I got the opportunity to join Brigham and Women for infectious disease. I was not planning to do infectious disease, but I was like, this is one of the opportunity I can take. I can get a letter of recommendation. It has like Brigham and Women Hospital name on it. So I will have a mentor there, guide me through residency application. So, but I was not planning to do infectious disease. I know that you have a background in research. I think hematology, oncology research also. Were you planning to do oncology at that time, or that something came during the residency?
أنا my main mentor لما جيت على Mayo Clinic my main mentor was actually his background is neurology العصبية بس الشغل اللي كنت عم بشتغله مع المنتور العصبية كان in paraneoplastic encephalitis يعني كان بين النيورولوجي والأونكولوجي. At the end of the day لما نجي نحن على position research as you probably said يعني ما بيكون عندنا كتير choice in شو المنتور يعني بالاخير انت بتجي على المنتور تبعك مين بوافق لك بتاخده. لما بلشت ريزدنسي الكلينيكال اكسبيرينس اللي باول 6 شهور كانت اكثر بالبانكريت. ف I was thinking I was considering very يعني very highly انه اعمل بانكريت. بس بعدين I would say starting يعني January February لما عملت الأونكولوجي clinic و that's I think when I decided by the end of the first year كنت خلص يعني switched completely. بس بهي transition بالتاني 6 شهور من ال first year هي when I made my decision.
I see. I see. Yeah, so technically during your residency. Okay.
Yep.
Were you looking for mentor during around that, like when you started the residency, or that happened after you decided on the fellowship?
أنا بصراحة what بعد after I decided أنا ما كان بدي أبلش مع حدا شغل before إنه خلص إنه at least I have an idea شو بدي أسوي. هلا I met with people يعني أنت بالأخير mentor again يعني هلا في research that I was talking about it was important بس هذا أنا ما بلشت معه relationship لوقت ما يعني خلص I identified شو اللي بدي أشتغل عليه. بس في اللي هو الكارير منتور اللي كان دكتور طارق عم يحكي عليه او الادفايزر او هدول الناس يعني بالاخير I met with a lot of them you know بالبونكريت حتى بالكارديولوجي بكذا just to talk about يعني what do you think about your specialty شو المنيح شو المو منيح كذا. هاي بأول 6 شهور و you know that's هيك بخلي عندك توجه يعني at least يعني انه هاي الشغله definitely ما بدي اياها هاي maybe not. بعدين لما بلشت I was more interested بالoncology very يعني خلال شهر كنت already يعني identified 2 people كنت عم بشتغل معهم وقعدت معهم وبالاخير one of them was my actual like يعني المنتور لاخر الريزدنسي والثاني بس اشتغلت معه research every now and then so yeah.
معنا دكتور نعيم بطيخ كمان. I would like to ask you a question actually. I know that you're pursuing cardiology fellowship. Let's say that you're you're currently now in a small community hospital and you want to pursue a cardiology fellowship. You don't have like a lot of mentor, like your cardiologist in the hospital private practice group, they just come see their patients and they have clinic in the afternoon, so they will leave some. So what's your advice to look out for mentors for people who want to do competitive fellowship in small community hospitals? How do you think they should tackle the mentorship thing?
You know, I think one of the things in you know in small I mean I trained in multiple institutions, all of them they were very big academic center, but I can imagine that if I'm in a small community hospital like Weiss Memorial here, I mean I would say across the town, they do not have even a fellowship in-house. And one of my friends and was my kind of a junior was trying to get into cardiology, and the problem is there's only 2 cardiologists and they are visiting there. So he had one chance, and I remember just talking back and forth about this and just trying to get an advice from what happened. So first you need, as Dr. Alyousef said, you need to be observable, like know how to be known. So bold, people, they want to invest in you. Someone look reliable. The first thing he did, like during his cardiology rotation, the first thing apart from the clinical experience or like showing his knowledge, etc., the commitment part. I think one of the things can help is showing some credential from your side. Open the go to the table and just bring a topic or a research idea that you are interested in, and show that mentor, that person, you are able to finish it from 1 to 10 under his mentorship. So at least like you're giving the credit that's unreliable. And then, by the way, sometimes in a small program, you have the credit for the fellowship a little bit sometimes on more in the big academic, because maybe you are the only one applying for cardiology from this program. So sometimes, especially on the city level or the state level, they are kind of, let's say you are the first and the only one coming from this program. And then you are presenting your program very well. And then they might like, okay, that's kind of this odds in your side. Like, let's say in county, 13 or 15 different residents, they applied for cardiology last year. So every single interview, like most of us in the interview days, like I know 4 or 5 of the applicants from my hospital. And that's kind of a challenge for me and for them, because we are all coming from the same program. So one advantage, maybe you are the only one are representing. The second thing I would say, if you have a mentor, and especially we're working in academia, I think the carte blanche is the research project. You show them that you are able to do stuff and you are reliable. And I cannot recall better advice than Alyousef mentioned when you come to your mentor, how you maintain the relationship with your mentor, check up that, then email, and then you after 3 months and recall. This I think this is can help in a small community or even in a big academic center. That just came to my mind. I'm not sure because I never worked in a small community hospital. It's a challenge. I can echo that.
Right, right. No, thank you
Yeah.
so much. That was very good advices actually. And I would probably add, and you're part, like Naim, are you part of like are you a member of ACC?
Oh yeah, yeah.
Okay,
That's the
so
first thing I did when I came here to the state. They told me that it's a good idea. And it
yes,
was a great idea.
so right. So for example, like if you're going to a small community hospital, you don't have any good mentor there. ACC, like American College of Cardiology, it's a free membership.
Right.
You can be a member. You can attend your local chapter meetings. Find the mentors there. And did you attend any of your local chapter
Yeah.
meetings, Naim?
There's one thing also that's interesting. I presented one case from our hospital in one of the Illinois North chapter, and one of the attending were there, they from all over Chicago, and they're also in Illinois. And then, believe it or not, it was like kind of a green card to get an interview in Northwestern here. So by chance, the program director was the ACC North chapter governor, and then he was attending the session. I was presenting a case. I didn't know who that guy even, and then he asked me a couple of questions, and then he knows from county, and he had a kind of everybody knows everybody here. So I was presenting, and it was a very good chance to show that we have kind of like you have a potential. You can present some stuff, and based on that, can get a contact with him, and then start building later on a different kind of mentorship outside my institution. So absolutely, ACC chapters will help, especially in cardiology. I don't have much experience in other specialty.
Right, right. No, I agree. I totally agree with you. I got when I was applying for cardiology, I think I got 4 or 5 interviews because I attended the ACC
Yeah.
conference. It's you guys will have CME money in every program. So we're talking about ACC because we know ACC, but like all the other specialties, they have their own big community. They have big meetings, conferences too. So Bakri, if I would now you are a fellow now, mashallah. It looks like you're successful since day one. You know what you want to do and you match in a good program. But if I ask you if there is one thing that one mistake or one thing that you did during your residency, you would avoid if you can go back. Do you remember? It's especially related to the fellowship or career planning.
I'm gonna stick to the theme of research just because that's what I'm asked for. I think that I started many projects during residency at the same time, and it kind of made me neglect a little bit the education of my own education in internal medicine. هلا بالinternal medicine, at the end of the day, you want to be a good internist. يعني research should complement, and I talk about that بالpresentation. Research should only complement الشغلات التانية اللي انت عم تشتغلها اللي هي mainly related to your education بالinternal medicine بكل الفيلدز. يعني بالاخر انت you want to be an internist and you want to be board certified. فانا بوقتها اشتغلت كثير على الريسيرش and at some point خلينا نقول I neglected education. Fortunately أنا عندي بالفellowship أول شهر بيعطونا إياه off, so I was able to catch up وعملت البوردز. But if something I would change if I go back, I wouldn't take so many projects at the same time. I would focus a little more on my own education مثل اللي كان عم يحكي نعيم from all the resources. أنا بلشت فيها كثير متأخر يعني. That's what I would change.
I see. So, Naim, if you would say that this is the biggest thing that you've had during residency helped you to match in the fellowship, what would that be?
The best thing that helped me to match in the fellowship, I think the scholar activities. Three things. I'm not an ideal case. I did multiple residency, so you cannot compare fresh residents to my case. But in my residency, I invested much time in the last residency, let me say, here in county, more in research and doing a master in clinical research. So that's kind of give me an edge when the interview hit. They asking a lot about, especially the big academic center. They will ask you more about research, about these kind of masters and this stuff. But I would say one thing always help like always make helpful in the cardiology, especially in the fellowship. I felt it's making connection. Connection in all, by all means, like connection in the level of your hospital, in the level of your city, wherever you are, in the level of the whole nation. And then what I found is the most helpful part, you get a mentor from inside the institution and get another mentor from the outside institution, or an institution in mind that you might match later on, or you are preparing yourself to match there. And the most important thing here, when you get your mentor, wherever from where, get in touch with this person during the conferences. So let's say one of the techniques you can work on, this mentor, let's say it's from Rush here University, and then I'm from Cook County, and then I call my mentor before the ACC chapter, and I tell him, like, are you coming, or we'll have a chat in the conference, and you have a project in the same time. So you build a relationship with a mentor on the longitudinal way, and then that's kind of expose you to different institutions at the same time, and have more chances to get more interview in the future. So I feel this is the golden card that's people, if they want to match in a very high academic center, to have a mentor from that center. I'm not saying that's the case in every single situation, but I felt this is the most helpful apart from your scholar activities.
I totally agree. Like, I'm all about networking and connection. Since that the question is for like either for Bakri or Naim, you're attending a meeting, national or just like on state level, and you want to introduce yourself to a program director sitting there, or a chair of the field that you would want to apply. How would you introduce yourself? Because you know how many Naim and Bakri going to introduce themselves to this person. So how are you going to introduce yourself to make it that he will remember you when you apply, or if you want to make a connect, if you want to connect with him in the near future? It's for any of you, like Naim or Bakri, whoever wants to answer this question.
I'll start, and then Naim can also comment. So Hala, I'll be totally honest. I've never went to a program director personally, and I told them, hey, my name is whatever. I'm applying for a fellowship. I saw people doing it. And the way you can do it is, if I was gonna do it, and hey, my name is Kaza, I'm from this residency. I'm applying for whatever oncology. Can you give me some advice about like what are the things that your program is looking for? Because remember, in Nahib al-Akhir, it's not gonna make them remember you. What people remember, that's my personal experience. أنا مثل نعيم بالآخر الماتch بالأخير how I matched was based on a presentation that I had in a conference. والprogram director, my program director كان واحد من الحاضرين بالconference تبعي. لما نزلت من البوديوم, that's how I got the call about the interview. So what people remember is your work, your own work. يعني اشتغلت, عملت presentation, هالpresentation حضره الprogram director. They're going to ask you, يعني انت وين, هتقدم ما هتقدم. And that's how I got my own interview. But again, if I was going to approach someone, preferable انه يكون في عندي شغل. مثلا خلينا نقول انه انا بعرف هذا البروجرام دايركتور مثلا بشتغل بالليمفوما, مثلا انا بالانكولوجي وانا مشتغل بروجكت بالليمفوما. Well, I can kind of هيك ادخل الموضوع من هيك انه what do you think about مثلا ال treatment for this particular, I did this project about this. بعدين هيك بس يبلش يصير في حكي, I can talk about like, hey, I'm interested بالapplication, or how do you wanna what do you think I should work on. بس بالآخر, again, I didn't do it. The way that I thought was best, and that's how they remembered me, was by my own work. عملت presentation, they saw me, that's how I got the fellowship.
Right.
بدك العنب ولا نقاتل الناطور؟
بدي العنب والناطور.
طيب. خيو, أنا my advice here, and that's what I did. I have like 30 or 40 program in mind for cardiology. And I searched every single program director, every single one. And I made sure 2 years before, like I have an extra year as a chief, I made sure those people are attending what kind of conferences. And I set the setting. So let's say I know like program director of Yale is in imaging, so he will be interested in cases in imaging. So I know he's coming to the ACC, and I look at the ACC, where he will be panel in, and I go to that panel. and I show the interest and kind of question answer things. So it's all about like يعني عم بتصيد بالconferences لانه as you said there is millions or يمكن 1000 واحد مثلي او مثل بكري بالاي سي سي conference or غيرهم. They are showing their potential. Now how I approach them on the either in the dinner or the lunch, but make sure their belly are full, they are relaxed, and then immediately go there. Introduce myself. I'm always I introduce myself as a collaborator, and I want some guidance, but I am collaborator. I'm not as someone I know nothing and I'm come to you from the scratch. Please teach me. This is kind of a burden for the mentor. I show them that I have stuff, and then I want some guidance from your side, but in the same times I can collaborate in 1 and 2 and 3 and 4. I'm just selling myself, but in an appropriate way. So I set a lot of settings. As I said, one of the things here in the North Illinois, it helped me to recognize who is the program director in Loyola in Northwestern. Already Alyousef is معلمنا يعني. I know him from the hospital, so I do not need to impress him. So, and always the first impression will seal the deal. Like when they take an impression and someone is just presenting or like having some skills, they want to know you. And I have my secret statement. Like I am like, let's say when I present myself, I always tell them that I'm a resident from Cook County. I'm a BGY 12. There's something very unique about myself. They will remember at the end of the day that someone approached me with the name is BGY 12. I mean, how many BGY 12 they will approach you and send an SAC? I use my kind of a technique or like a bold statement they will remember. I make sure they will next conference, if they see me, they recognize me. So that's kind of a strategic technique.
Yeah. Actually, it looks like it's a cardiology theme.
Yes.
Because I did the same thing actually.
Yes.
Before the ACC, searched all the programs that I'm interested in, searched all the people who's attending, what are they presenting, but at the same time I kept it this in a way that, like, let's say sport, like arrhythmia in sport medicine. So I try to search for people who's like cardiologists who's talking about like the arrhythmia in athletes, and this is subject that I'm interested in. So it was kind of like win-win for them and for me. I read about the topic, and at the same time I learned more about these people. So I introduced myself to them, and in a way that I start build a connection with them. You want to add something?
You can use LinkedIn. Very helpful. LinkedIn, just to connect with your mentor before the conferences and like make sure that they are coming, or a short email or whatever, that I'm interested to see you. And then people here are very helpful and cooperative.
Right.
But for us as IMGs, it's very challenging and competitive, like fellowship, to show yourself and then just to be like in the cohort. Like it's not easy to stand out.
Right.
Yeah.
So Maya, she joined us now, and we were talking, Maya, about the fellowship and career planning. I would like to ask you a question about building your CV during your residency. Were you thinking first, I know that you're a pulmonary fellow now at Cincinnati Hospital. When you started your residency, let's say that either if you knew that you want to do pulmonary or not, when you were trying to build your CV, build your connection in the hospital, were you focusing on the pulmonologist or no, all of your attending? And I will ask you later about the letter of recommendation. So let's go with the first question first.
Good morning, everyone. I apologize for the delay. All the invites went to junk, and I'm working on editing a chapter, so it got busy. But just to briefly introduce myself, I'm Maya. I'm a first-year fellow in Cincinnati Children's Hospital in the Pediatric Pulmonary Division, and I did my residency in a smaller program in Michigan, so it was a huge transition. So I'm happy to talk about this too, Kaman. بالنسبة لسؤالك, so I knew when I went to residency that I wanted to do a fellowship. What I first thought is I wanted to do neonatology. I was working around that. I was a diehard NICU. يعني حتى I did a rotation in my residency. I thought this was for me. But I knew كمان part of it what I did not want. فمثلا أكيد I know there's a lot of cardiology fellows here, but each one is meant to be in a certain place. I didn't feel like I wanted to do cardiology or GI. So I knew I wouldn't my top priority is not reaching out to mentors in cardiology or GI and no neonatology. If I reached out to neonatology mentors, I started my research, and then when I decided to do pulmonary, that was end of my second year, فكان 2 months قبل إيراس. I realized like for a lot of reasons that neonatology is not gonna work for like long hours, and like it's just like there's the work-life balance was not great. If I wanted a rewarding career with procedures, with like continuity of care, my work-life balance. So that's why I thought pulmonary was the perfect balance. Then you still go to the ICU, you do bronchoscopies, you can do interventional pulm and a clinic and still have a career outside of medicine. I mean, a life outside of medicine. I chose this like quite late, relatively later, but I was still, as you said, building the CV in between. So what I did is, first of all, like I started my research idea end of first year, and then I worked on my RB second year. Hello, one thing to keep in mind, at least for pediatric fellowships, nobody's gonna like in the fellowship interview say, why are you doing a cardiology research and you're interviewing for a pulmonary fellowship? Nobody's gonna judge that. They all know some people change their mind, some are undecided. But honestly, they just want you to know that you're someone who can work and juggle it with residency. And then, like, if there was any voluntary, like, and for me, like, especially residency, you're working 80 hours a week, let alone some programs, they make you work 24 hours. But it's quality over quantity on what you want to add to your CV, especially that the IRAS now is capped at 10. For me, like, I focused on something that I can talk about in fellowship interviews and I can, like, I'm happily willing to share. So, for example, I did go with SAMS in second year to a medical mission in Jordan. So it really helped me a lot. I explored like حتى even pulmonary. I explored like long-term asthma care, how it's very important. I know it's still less of my clinical interest right now, but it really helped me as a person and as something to the CV. And I also did chief residency. So like for me, maybe I did 2 or 3 things rather than 10 things that I don't know what to talk about. So that will be my advice. Residency is hard. I will say the first 6 months, like a timeline building CV, focus on being a resident, especially as an IMG. It's a very big shift in healthcare system. And like you need to know how to get used to your resources, to your social workers, to your care management, to your relationship with your seniors, to the different culture, how you read the room. So first 6 months, just learn how to be a doctor. And then the next 6 months of first year, maybe you can start working on a research idea, exploring your major. What do you want to do after it? It's okay if you don't have an answer on what you want to do. Like one of my co-residents didn't know she wanted to do her fellowship until 2 months before Iras came out. She like, yeah, I want to do pulmonary too. But um, so take your time exploring, be graceful about it. You don't have to have everything figured out right now. But at least, for example, start with a research idea. Maybe you have a question about something you've been seeing, like, why are we doing this? Maybe you can make a research about it. And then like looking into the community activities, come on, any residency programs, I'm sure they talk about it, come on. There's a lot of opportunities to do that as well. But just focusing on quality things and like start your research ahead of time just so you don't get crammed by third year and like just being overwhelmed and then you're having a full-time job, fellowship interviews, onboarding. It's going to be a lot of things.
Yeah. Thank you so much, Maya. That
Yeah.
was very valid advices. Quick question for you. Since that you mentioned that you were thinking about neonatology and then you switched to pulmonology. When did you switch? First year or second year?
I switched April of second year and ERAS opens in June.
Good. So yeah, good. So my next question is, see, you were talking about like start research projects early after like the first 6 months to learn how to survive in residency. So did you do any research in neonatology?
So my project was in neonatology. It was more of a health disparity project, but honestly, like in all the fellowship interviews I had, like even Cincinnati Children's, Texas Children's Hospital, Philadelphia, nobody said why you have nothing in pulmonary. But of course, like that doesn't cancel the fact that you have to show interest in pulmonary with your personal statement, with your CV. And then like they understand that people change their mind. People sometimes take long time to figure it out. So nobody from my experience was asked, why are you doing a research in something that's not related to your field? Hello, one thing is that my hospital and residency was not a cystic fibrosis center, and I wanted to get that experience because it's one of my clinical interests. If I went to University of Michigan for a month. So like all of these add up to your CV, like screaming clinical interest. And like even University of Michigan was nice enough to to like give me the opportunity, but president roundtable aboard of the CF conference. But like all of these added up to the CV to show like interest. So even if it doesn't show in research, you have to show it somewhere else.
That's excellent actually. So basically, you had a letter of recommendation from University of Michigan talking that you're interested in pulmonary.
I did not get it from University of Michigan, full disclosure, because I rotated with them in October during fellowship interviews. I got from my program director, that's mandatory. I got from the division chief of my hospital in residency. And I got the third one from one of the pediatric attendings with me in SAMS.
I see.
Yeah.
Yeah, that's excellent. So since that you joined us now, so we were talking about something, you mentioned it already, that if someone in a small community hospital, how are they gonna tackle to apply for a fellowship, competitive or not competitive, but they don't have enough mentors in their hospital to guide them to apply for this fellowship. So I'll switch this shift this question to you since that you already mentioned it.
Okay, so I think it's like first of all, your letters of recommendation are gonna speak it all. So like the number one, this is gonna help because again, all of these connections, like from my experience till this date, it's like, for example, let's say I'm in a very prestigious fellowship program and I want to recommend someone. It's not recommending, it's me reaching out saying, hey, can you read this application? It's a huge liability to recommend someone, right? So for me, it's like number one, work on your application to be strong enough so when it's recommended, you can get the invite. Number two, so for me, pulmonary is a very small area. I don't know if you know, pediatric pulmonary is like critically short in the US. Like there's only 1,000 board certified pulmonologists in the United States, so they need a lot of pulmonologists. So like يعني بنت حارتهم ضايقوا بيعرفوا بعض الpulmonologist. ف like for example, when I spoke with my mentor, although we were at a small community hospital, she knew some attendings herself, like for example at Pittsburgh or like other places. So she was helpful too, or where she trained for fellowship. So all of these like connections helped. And then I was already in contact with the University of Michigan because you had to arrange with them the rotation 6 months prior. So I was talking to them even before ERAS opened in April. So like we have been in contact, we have been in like yani, talking the whole time. So they were the first ones who sent me an interview because they knew me by then, even before I came in. But they had some condition to interview before I come in, just for bias, but that's something else. And then for Cincinnati Children's, where I ended up in, it was ranked number one in pulmonary on the US news, and I had no connections there. I think what I did, it's like كمان كله من Allah. And I remember I just emailed the program director on like the first week within submission, and I expressed my interest and that I'm from the area, I'm from the Midwest, I want to stay there. And I was lucky enough to get an interview. We were 22 candidates over 4 positions, and there was a lot of internal candidates that take more priority. And subhanAllah, and I was able to come in.
Allah, mashallah. That was impressive. I want to highlight something that you guys, all of you mentioned, and I'll probably ask Bakri and Naim to add some comments on this because Maya already mentioned it. Personally, I think the most thing helped me in the fellowship. I was asking Naim and Bakri, like, what's the thing that you think helped you the most during applying for the fellowship? They mentioned like the research. Personally, I would say the letter of recommendations. I've like during my cardiology interviews and during my electro EP fellowship interviews, the first thing that they mentioned to me that you have impressive letters. The first thing. So that shows that this is even before I say a word, that showed them that okay, this guy, he's a hard worker, he's a professional, he checked all the boxes that we are looking for as a fellow. So that helped me a lot actually even during the interviews themselves because they picked something from the letter of recommendation of my program director and they start talking to that about me and if they pick something that my program director mentioned and I did that during my fellowship, it's an easy question for me. So technically they're not going out of the box asking me some weirdo question. So I think if I pick one thing help me, I would say personally letter of recommendation because I've been asked almost always like about like the impressive letter of recommendation. So what do you think, Maya, about that?
I strongly echo it. Nobody asked me about my research experience or what are you doing. I think at least I can say 3 interviews out of plenty that I did, they talked about my letters of recommendations, and I was so curious to read what was written in them.
What I know that Naim, you mentioned the Naim and Bakri, you guys mentioned the research, but do you want to add anything about like the letter of recommendation and showing hard worker during the residency?
I mean, I just missed that because I thought this is kind of a obvious thing for everybody. I mean, letter of recommendation is everything. I mean, I was just talking in a situation that already we secured the letter of recommendation, and then what's the extra? But if we start from the scratch, letter of recommendation is the most important thing that you have because it's literally summarizing your behavior in the last 3 years or 4 years. And if your program director is kind of mentioned something very personal about you, or your program director is very well known in the area, or your chief in cardiology or whoever is writing the letters, and he's very well known, and he's writing speaking highly about you, that's kind of also another green card for you for having a lot of interviews. Absolutely, the letter of recommendation, that's one of the most important things that you can work through, and that's why you gonna plan your mentor ahead and look who is the chief there or who is the program director, start working with them in your subspecialty, and then show them the potential, and then you get the best letter of recommendation. I always say, if you want to get 2 different letter of recommendation from, let's say, the first one is talking as generic words about you, but coming from a very important person, or a very personal letter of recommendation from a normal person, get the personal one. This is more important. The name of the person is not more important than the personal material inside this letter. That's in my experience, at least. So absolutely, I agree 100%.
Bakri, do you want to add anything about the letter of recommendation?
Yeah, all I want to say is that different programs value different things. Certain programs are going to value letters of recommendations. Almost all programs value the letters of recommendations very, very highly, and so it's always important. But what everyone should get from this, this is again not a fellowship session, but what everyone needs to get from this is that it's very important that your application is perfect from every part, من السكولر part, من letters part, من حتى personal statement. I heard about people got picked best لأنه personal statement had some personal story about them growing up somewhere, So obviously it was very important to me also in oncology, but again, it's very personal to every program.
Right. Yeah, thank you. Yeah, it looks like we are all agreed on the letter of recommendations. I will start with taking some questions from you guys if you want to raise your hand or so. All right, so we're gonna take questions now by raising hands. Meanwhile, I'll also emphasize on like the letter of recommendation. It shows, as we mentioned, that you are a hard worker, you are a professional, you are dedicated to your residency and future plans. We have a question from Muaz. We'll start with Muaz. تفضل Muaz. You can unmute yourself.
السلام عليكم جميعا، يعطيكم العافية على الجلسة. هلا ما بعرف إذا هالنقطة انذكرت من قبل لأني انضميت من شوي، بس شو أهمية المنتور إنه يكون موجود، وشو أصلا المنتور ممكن يساعد؟ شكرا.
Okay, شكرا. We talked about the mentor, but we will go briefly on it because we will have that after that. The next question from Abdul Qadir. Maya, would you like to talk a little bit about the mentor, if you don't mind?
Yeah,
Briefly.
hi, assalamu alaikum, Muaz. Yeah, having a mentor is very important because they can help you navigate through like building your application, improving your CV, and also during fellowship interviews and the fellowship season, they can help you like how to navigate through it. So I think my mentor, like she was the division chief of pulmonology, she helped me a lot. So for me, I knew I wanted to stay in the Midwest. My residency was in Michigan. I wanted to stay in the Midwest. But I remember she was the one, for example, who pushed me out of the comfort zone. She's like, pulmonology fellowship. So when you're in attending, they're going to say where you came from fellowship. Nobody's going to say where you came from residency. So that's your trademark. So I remember she pushed me, for example, out of the comfort zone to interview in Texas, to interview in Philadelphia, and just see what they have. And I really had great experiences with them. But I was, again, fortunate enough to get interview from Cincinnati. That's closer to family. And that's how I eventually ranked it first. But still, it was nice to see because also, like, I learned I met new people along the way who will be like future attendings that I'm going to be talking with when we deal with patients across states. Also like, yeah, I remember her pushing me to go to University of Michigan, and like I think mentors will push you out of your comfort zone to set you up for success. So it's very important to have someone, especially if you're talking about a competitive field.
Thank you.
Okay,
I
should
agree
it
with
be
you.
from the program itself or?
It
Go ahead.
doesn't have to be from the same specialty, but I will strongly prefer it, especially if you're talking about something competitive like cardiology, which I'll let my colleagues speak for that more. But yeah.
All right. Thank you, Maya. عبد
فيني بس
تفضل
دكتور نقطة صغيرة بس لمعاذ. معاذ فيني لخص لك المنتور بجملة واحدة. هو الجاد فاذر بكل معنى الكلمة. هو شخص جاي من المستقبل وجاي عم بيفصل لك المستقبل على قياسك حسب البوتنشال تبعك. تمام. لانه انت وقت بتفوت على الريزدنسي شغله كثير جديده عليك، ما بتعرف كيف بدك تمشي بالعتمه ولا الضوء. هو فعلا اذا كنت بوتنشال تبعك واضح هو الشخص اللي بيودي لك هذا الجايدنس. فضروري جدا to have one mentor at least in your program اذا بدك fellowship او even if رايح على hospital medicine.
All right. Thank you, Naim.
يعطيكم
We'll
العافية.
have Abdul Qadir.
السلام
Naim, you
عليكم.
have a question on the chat, so I will take the Abdul Qadir question and then I will take the answer from you from the chat.
السلام
Okay,
عليكم.
go ahead, Abdul Qadir.
سؤالي أساسا للدكتور نعيم أساسا. How do you know this mentor is not a fit for you?
How do I know this mentor is not a fit for me?
Like for me, for the resident, for like the person who.
All right, that's a great question. So in my case, and Dr. Alyousef mentioned this before, the moment you step into the residency, you start screening for mentors. Maybe they agree with me or maybe they disagree. He mentioned about the coaching, etc. Coaching, mentorship is kind of something different. But for me, the moment I step into the residency, I start scanning for internal medicine mentor and for cardiology mentor. And by scanning, that's literally seeing every single attending, the best attending that we have, knowledge-wise, scholarity-wise as well, because I'm looking for research. So I try to align, like risk stratification, literally. So I start to align what's my goal. Let's say I want a cardiology. Who's the best attending in cardiology? I want intervention. Let's say Alyousef, we have in an intervention. So I get a knock in his door or send an email or whatever. We'll have the first meeting. Maybe we'll align together. Maybe we'll click in, maybe not. So I have kind of, let's say I'm interested in this thing and I feel like my mentor kind of guide me in this way. Let's say that my subspecialty. And medicine is not hard. Usually it's one of the core faculty, either program director, associate program director. Mine, it was the firm chief, which is one of the associate program director. I liked his educational technique. I liked his knowledge fund and also his scholarity. And I learned from him some stuff about residency, but because I'm looking for fellowship, my investment was in the cardiology mentors. So I scanned 13 different attending in my hospital, literally. I'm not interested in imaging, obviously, and I look at the attending. I look who is the one who has the highest potential. Like that's my passion. I want someone aligning with my potential, and who is the one who is having also time, because you cannot address the chief of cardiology who has like maybe half an hour the whole entire week just to see you very quick. You need someone also have some time just to work with you, sometimes some project. I mean, scanning, like screening, and then start rolling out. And then literally by the half of the second year, the half of the first year, you can scan half of your faculty. Plus, if you work with someone with them, sometimes you have the chance to work with them and you ask your chief resident or whoever doing the schedule to make the time or make you rotating with this person or other person that you are interested to work on, just to have more idea about their potential.
Thank you so much, Naim.
السلام
We will take دكتور بكري الله يجزيك الخير عم تجاوب على الأسئلة اللي related to hematology oncology on the chat. We have 2 questions there on the chat. Meanwhile, we're going to take Lynn Hussein question. Go ahead, Lynn.
Hi, everyone. I just want to say that it's good seeing some familiar faces after the boot camp that SAMS did during the interview season. Thank you, which was very helpful. I actually wanted to ask a question as someone who's interested in pursuing fellowship. This question, I would say, is targeted towards people who are in the decision making when like choosing applicants. how important do you think being active on LinkedIn, MedX in the whole decision making when you're like choosing a fellow?
All right. Bakri, if you'd like to answer this
Can
question.
you summarize the question? I'm so sorry, كنت عم بجاوب على السؤال.
Sorry.
I can
Okay.
just answer, and then you can just
Go ahead,
circle
Naim.
back and you add some points. I would say we are in an era that the data viz, with data visualization, is making a huge say in fellowship application if you are pursuing a very high level academic center. And if you look at LinkedIn or X or whatever, look at the big center and you will see their fellowship program. They have already a page and they literally feature every single activity. And then they want people to represent them in the same manner. Let's take an example like University of Michigan or Northwestern or even Brigham and Women. They have their own kind of thing. If you have a LinkedIn page, that will help you to connect with your mentors, and then they will see your activities. Like literally X and LinkedIn is the best way to show your mentors or your future fellowship program that you are actively working in research. And the way how you present yourself on these platform is very important. When you mention your research and you add this data vid and that's what I found, and people are following you and asking you a follow-up question about your research, that's literally an example. And to speak about yourself in an indirect way, which is in your program director or whoever is seeing that by chance or by labeling. Sometimes I add literally I add hashtags to make sure that this going through many of the cardiology programs around the nation. I would say it's very important, but again, it's kind of نحن بنقول له سلاح ذو حدين. يعني the sword double edge. So make sure that when you are representing yourself, it's in a way that you kind of send a message. Let's look at me. I'm super active. I have all this clarity. And then people, they look. Everybody has a LinkedIn account nowadays.
Thank you. Thank you so much, Naim. I think Naim, he tackled your question. So now we will shift gears and we'll start our next session. Omar, you'll take it from here. Thank you so much, guys, for attending this session, and I will be in the background. Omar, go ahead.
السلام عليكم جميعا. الصوت مسموع، كل شيء مسموع ما هيك؟ الله يجزيكم خير يا رب. يعني هو نحن هلا صرنا ريزيدنت، بس لحد الآن والله دوم نتعلم الجلسات والحكي. نكون سعيدين جدا يعني بحضور الجميع وشوفتكم جميعا. إن شاء الله الجلسة رح تكون مركزة على الحياة الاجتماعية بشكل أكبر، كيف نتعامل نحن مع الستريس. إن شاء الله رح يكون معنا 3 محاضرين أو هيك دردشة خلينا نقول. بداية رح نفتحها إن شاء الله مع الدكتور مصعب المصدق. الدكتور مصعب المصدق هو طبيب أمراض النوم، طبيب عناية مشددة في شيكاغو، مهتم بتغيير السلوك البشري. إن شاء الله رح نكون عم دردش مع الدكتور مصعب. خلينا نقول على 3 محاور أساسية. المحور الأول هو كيف أنا محافظ على الصحة النفسية ضمن الريسيدنسي، شو هي العادات اللي بكون عم أكتسبها مشان ما أوصل لاحتراق ضمن الريسيدنسي. النقطة الثانية إن شاء الله رح نكون عم نحكي عليها هي موضوع كيف أنا يعني أحس إنه يعني بحاجة لدعم، إيمت بحاجة لأطلب مساعدة. النقطة الثالثة شو هي الأساليب اللي لازم أكون عم أتبعها في الحال أنا مثلا لازمني مساعدة، كيف أطلب مساعدة من العالم، شو هي أيضا النصائح الأخرى مشان أكون أنا عم أعالج الاحتراق الوظيفي. الله يجزيكم خير دكتور مصعب، عارفان يوم اون كول، فشكرا كثير على حضوركم معنا. دائما نكون سعيدين ولو بالسماع لكم. تفضلوا دكتور مصعب.
السلام عليكم، الله يعطيكم العافية. آم، أنا أول شيء يعني شو بدي أقول بنص النوبة، بس قلت I would I have يعني the honor and privilege to serve. مفروض أحكي بالعربي ولا بالإنجليزي؟
It's up to you دكتور مصعب يعني
Okay.
feel free to talk English, Arabic.
طيب أنا راح أحكي أكثر بالإنجليزي، وإذا بده حدا
Okay.
يحكي على العربي ما في مشكلة يعني، بس
Yeah.
it's just easier. طيب I'm a certified high performance coach, and I'll be talk to you. Let me see if I can share my slides. And I guess I can. You see it?
إيه
Yes?
شايفينها دكتور مصعب.
Okay, perfect. So welcome everyone. أهلا بكل الintern والcoming intern. And I know this is not what you want to focus on, stress and burnout, but it's actually the reality that our life is going to include a lot of stressful events, work environment that has pressure, high pressure things, and you would really need to armor yourself, تتسلح يعني whatever it takes to help you handle things better. ما شاء الله عليكم that you all worked hard to get through med school, to get here, to get through, and now you're going to residency, and we're just starting. But that just tells me you guys are strivers, you work hard, and this is not another hurdle that you cannot overcome. It's like anything else that you went through. So inshallah, you will do just fine. So my goal today is to help you at the end of this talk is to handle stress better. If is to learn how to master your mind and to see how, I could actually handle stress better by taking a few tools that I'll teach you through this session, inshallah. So, because the main reason is stress isn't going away. You're going to have to deal with stress. It's just part of the game. And you could avoid, but that's always a short-term strategy, but that doesn't solve the problem. So you have to learn how to deal with stress. So let's go over what is burnout. Basically, it's a state of mental, physical, and emotional exhaustion. Like you feel really you're exhausted, you feel you're drained, you're on empty tank, you just can't do anything. And this is actually happening more commonly than people think. Let me ask you questions, and you could answer by writing yes or I in the chat or raising your hand. Either raise your hand if you see any of the condition that you deal with. Any one of you feels that you're going to go to work and you have very little control over your work? Here we go. Someone, Murad. Anyone feels that when you go to residency, you're going to have overly demanding job expectations? They have an expectation that you do certain standard, you do things to a certain way. And anyone feel like it's going to be a chaotic or high pressure environment? And obviously, most of you would think, okay, anyone think they're going to get plenty of sleep when they're intern, right? Uh, you're going to have sometime not enough sleep. And sometime people may not have enough, like, social support. Your family is abroad. You're not, you're by yourself in that town, or you're just got to know people. And sometime you may deal with lack of recognition. Uh, anybody does not deal with any of those conditions that I shared. But most of us actually deal with this. I actually put that question backwards because I asked ChatGPT, what are the causes of burnout? And this is what ChatGPT listed. And in reality, all of us deal with this stuff. And the best way is to understand you are going to be in a high pressure with high expectations, with sometime not enough sleep, but you still can not everyone will have the burnout, even though those conditions almost everyone deals with them. Why we're talking about burnout? Because it's been so common. The American Medical Association just celebrated that we dropped below 50% of physicians. So when we testing physician for the first time in 2025, last year, we went down below 50% of physicians. They're feeling the burnout. That is actually huge. So still 48.3%, that's 50%. That means half of the doctors are feeling the burnout. So we really got to find a better way of how to deal with this. And of course, yes, you could take more breaks, and yes, but you know what? If we don't learn how to handle stress better, it's going to be a problem, no matter how many breaks you take. So signs of the burnout is, probably most of you know, you have low energy, feel exhausted, you could lose the ability to concentrate that well. The performance goes down a little bit. Sometimes some people become withdrawn, cynical about situations, looking negatively about things. Or sometimes you're dealing with physical symptoms, chest pain, nausea, abdominal pain, insomnia, headache, all that. But the most um, concerning sign, and I'm talking about my own experience too, is when you lose empathy. Loss of empathy is one of the early signs of burnout, and it's actually very dangerous because when you start in your mind, like, I don't care, I just want to get through the day, then you don't like that on the inside. You don't like that about yourself because you wanted to go to medicine to help people. You want to go medicine to serve and do good with others, right? So when you're becoming like an I don't care person, it become a little bit harder pill to swallow. I personally, many years ago, I was going through those time where I felt like I'm a, what do you call that? Rat on the wheel, like the hamster on the wheel. And it's like life became like just not exciting. On the outside, I looked good. I was happily married, 4 kids, making good money. But on the inside, I did not like myself. That was the start of my journey looking for why this is happening to me. I wanted to be a doctor. Why I'm not happy? And I was kind of burning out, but I didn't know it. And that's why it's important to understand the symptoms to help yourself, if you need help, to ask for help. So who wants to be burnout free? Who wants to do his whole residency and be burnout free throughout? I mean, nobody taught me those skills, so I hope I could give you all those tools today, and I'm excited for you guys about your training and internship that's coming. And yeah, nobody or somebody raised their hand. I don't know. I didn't see that chat. Nobody wants to be burnout free. Okay, so before I start, I wanted to, here we go, someone. I want to just give you a little quick arching thought about how the mind works. So that the slides goes from left to right. The way we receive information, we get information through our senses, our vision, our hearing, our touch. We get the information, and what we do with the information depends on the interpretation that we make of the information. So I'll give you an example. If you bring someone here in July and you hear a lot of fire sound, they'll be excited and going out of the door to check the firework, especially in July in the US, right? You celebrate the Independence Day. You bring to the same room another person from Syria that just came out of war zone, and they hear the sound, the same sound, they're in the same room. Their immediate reaction is to take cover because their meaning, their interpretation of what they heard is different. Even like initially when we had those little kids, when they hear like a jet plane, they start crying They're like a year old, 2 years old, because they associated those sounds with a lot of painful memory. So the interpretation that we make to the event that we hear or see dictate what does that mean? So you could make an interpretation of this is good for me or this is bad for me. It all depends on how you think about it, right? So even if the program director in your program, he said, I want to see you before the end of the day in my office. Now you could make the interpretation العمل شو عكيت أنا شو عملت الله يستر لا يبدأ يخرب بيتي عرفت كيف؟ I could think in the worst scenario possible, but I could think, you know what? I'm gonna learn something about myself today. Somebody's gonna give me something to teach me about myself. Because you're in a training program, you think you're gonna go through without making mistakes? Like we think if I go through training, I should just hide anything so people see me as a perfect person. Actually, a training program designed for us to make mistakes. We all make mistakes. I've been practicing 25 years, I still make mistakes. But understanding that I need to learn as I go. I do my due diligence to understand and do my best. But if I make a mistake, I make a mistake, and this is how I'm gonna learn through it. So you could make the interpretation based on how you think of things, right? And that's all depending on how you think about subject. So you make the interpretation of the event that you received of information, and what you do with it, you make an intention. So like if you heard he said, oh, come to my desk, and I'm gonna just lay low and try to bring my best behavior, or you could just be excited, wanting to learn about what it is. Be open-minded. The intention of what you're gonna do with the event, with the interpretation of the event, also dictate, how this will go. Let's say you're
Question.
yes. Somebody has a question? No? Okay. So like if I go home and my wife yelled, I could make an interpretation of she doesn't respect me, she doesn't care, she's not listening, all that. And then what would I do with that information? How should I protect myself? I just show her what she needs to know, or how can I connect with her at a higher level? Or maybe she's struggling. You could make a different interpretation and different intention. And that's makes a whole, world of a difference. And then based on your intention, you take an action or you don't take an action. Now, all this cascade of it happens, by the way, in splits of seconds. All this is shaped by our identity about who we think we are. How do I look at myself? Do I see myself as trustworthy? Do I see myself as hardworking? Do I see myself as loving person? Or do I see myself as not enough? It's called identity shapes how we think of all those um, um, stimulations that happens to our brain. So I'll give you an example, a quick one. If I think of myself, I'm not good at business, I'm gonna hear the information that, oh, a business opportunity, but oh, most businesses they fail. That is true. And then I'm only filtering because I'm not good at business. That's my identity. Then my interpretation of the information that, oh, it's gonna fail because most businesses fails. Dollar is inflating like crazy, economy, wars, and then you make an intention of let me just protect myself, and you don't take any action. And all that is shaped by your identity that you think of yourself like you're not a business person. And it really affects how you make those interpretations. So this is just a whole arching way I'm just gonna give you, like, for any moment, for any thought that you get into your brain, there is something triggering this thought. And the beautiful thing is um, we can change whatever you have thought of yourself, whatever you have a previous perception about who you are, or whatever that something or thinking that's limiting you actually can change. Because we can actually, we've now know so much about neuroplasticity that we can rewire our brain. Like the minute you start formulating new thoughts, new actions, new intentions, and you keep firing those neurons, they said if you have a group of neurons and they keep firing repeatedly, you're going to build a new synapses, new connections, new pathways, and new networking. And you're going to build a new network if you continue to. So, literally speaking, you can rewire certain and new connections in your brain, and you rewire and build a better version of you. And that's the key. So, how can we reach another level? One, we can filter what information that we're consuming. What am I taking to my brain? Am I taking healthy information? Am I watching the healthy things? Am I just watching the news? Here in the US, news is just means scaring people because that's how they feed off and they get subscribers. They feed off fear. So if you're watching too much news, your brain is going to be, so you have to be guard of your mind, of what am I allowing to my brain so I can get right information, I can get things that would drain my mind, things would drain my energy. That's all up to me. Then I can make a different interpretation. If I'm constantly noticing that I'm kind of cynical about things, like I'm always negative about my interpretation, then maybe I need to look into that and reflect and see, like, how can I have more empowering thoughts that would elevate me? Same thing about the intention. If I've been making an intention based on just surviving, just going through, how can I make better intentions about how can I thrive even though I'm a foreigner? By the way, foreigners, they do really well when they work hard and when they come with great attitude, great mindset. And because you could outwork other people, right? You're very hardworking to get through here and you could just outpace people. Uh, but if I brought that better intention, better mindset, I'm likely to have a better advantage or more edge over other people. And then how can I take better action? So all this, as I change and fine tune my information and protect my mind and make better intention, better actions, I start to build a new identity. A new version of me start to show up. And you actually start getting even more excited about that. So I hope you all take this seriously because, we could put in better work in our mind and we can learn how to deal with stress. So let's get going quickly. Overwhelm factors, you just be mindful. Cognitive overload, like when you're having so many things all at once and try to solve so many problems at once, the brain just go out of, like, brain be fried. Like it feels like I can't do this. So as if you're opening in the computer like 20 tabs, they're all open. And brain cannot focus on more than one thing at a time. So you cannot have a very high focus on more than one thing. The second factor to bring overwhelm is the emotional fatigue. When you're dealing with sick patient, dying patient, it's kind of affects your mental energy. And if you don't learn how to reset, to regenerate more energy, better energy, release the tension, then, it piles up. And lastly is disconnection from purpose. And that's something I hope I hope I can bring that into you today, because if you're connected to who you are, why you went to medicine, and every day, and you put it in front of you, and you go every day with the intention to serve, to become a better person, you're gonna just have the edge. You're gonna have the edge, and it's gonna bring you so much more energy. So how to deal with stress and burnout? First, what thing is to recenter. Be aware when you start having those feelings of nervousness or negative thinking. And it's like, just, okay, I'm just feeling negative. Why do I feel negative? What is the trigger? What has brought this to my, and just try to bring some calmness. And basically just to deal with stress, stress is basically the sympathetic system is overwhelming. So heart rate fast, breathing fast, shallow, and you could reverse it physiology by just breathing slower. So just like 6 to 10 breaths that are deep breathing, slow deep breathing can actually just calm your brain down and slow your heart rate. So you could reverse that physiology. The second way is to reflect by always, when you do a little reflection every day, like at the end of the day, just have 5 minutes, what things went well, and just document it in your mind at least, and tell yourself, good job, you did well. Because most of you are very high achievers and very hard on yourself. Most of you. Most of you talk to yourself so harshly that you won't tell the same things to your friend, right? I'm guilty of that. So reflecting and understanding, and then, okay, every day, what's my intention? What do I want to do? What's my goals for the day? And I know you said I may not have time. Just take 1 minute, 2 minutes in the morning just to set those intention. And lastly is to connect to your purpose. And I'll give you a little bit more tool about this. Somebody made me that slide, but uh, uh, you connect to your purpose better when you set the intention in the morning, when you set the intention before you go to the hospital, when you set the intention at the time you're about to get off your car to the hospital, or just getting off in the elevator. Just like, who is that person that's coming today to work? What is the intention? How do I want to treat other people? Just that setting the intention, it puts your mental energy on a high note, and people see you in a better, like, just bright, more alive, more energized. The second way to connect to your purpose is to truly focus on what you can control. There's a lot of our things when you're doing residency are out of your control. What are the things that I can control? I can control my attitude. I can control how I show up. I can control how I can build skills. I can't control other people. I can control my energy. I can control how I control my emotions, by learning my emotions and learning how to tone them down when I feel negative, right? But I can't control everything. And it brings you so much anxiety when you try to control the things that you can't control. And third thing is to transition well. Every time you're trying to leave work, try to leave work at work. Like, just don't take it all home and keep the stress going. Just take those 2 minutes of deep breathing and just like release all that tension. Tell yourself, I'm just gonna release everything here because I'm going to relax at home. Because you really need to learn how to reset and recenter to actually keep going forward with high energy. I remember one day I put the schedule, I put myself 18 days in a row, ICU shift, 12 hours. I swear, day 1 and day 18, I had the same energy. I probably was slightly more excited at day 18 because I was going on a mission after. But I never got tired. Why? Because every time I go home, in my intention, when I go to sleep, I just let everything behind me and I wake up with a whole new day. So you always connect that way, you kind of release that every day is separate than the next day. And then lastly, lead from service, not survival. We've been taught بهالنظام اللي انقلع من عنا for 50 and 60 years to just دبر حالك. الشاطر اللي بيمشي حاله. So we lived and we've been breeded and taught for all our life to just live in a survival mode. Just get through. أمن حالك, who cares about anybody else? But when I start to lead from service, when I start leading from helping other people, from, taking the high road, from being the best version of me, a whole new person shows up. I know I want to just quickly touch on moral injury. I think I'm running out of time, but moral injury is different than burnout. Basically, you may feel the same thing, loss of concentration, upset, drained. Moral injury is when you actually do something and you don't believe in it. مثلا عندنا مريض مثلا الانشورنس رفضوا يبعتوه على مثلا على LTAC. LTAC is long acting long term acute care, and he really is not going to survive well in nursing home, and you know that, and you don't believe we're going to serve him well by sending him to nursing home, yet it's out of your control. It's a system problem. It's not your problem. And you feel like I'm not serving that patient because I'm throwing him into the unknown, but they're not going to take good care of him. Sometime moral injury is لما المستشفى بيقول لك روح خرج المرضى اللي short stay أو ال 24 hours observation أول شيء، وما تروح تشوف المريض التعبان قبل. وأنت يعني consciously you want to take care of the sick ones, so you don't feel like this is serving or this is right because it's going against your belief. That's what brings moral injury, I'm sorry. And that's usually solved by standing up and discussing with administrations and working out through those things.
السلام عليكم دكتور. الله يعطيكم العافية يا رب. هل ممكن نبلش من هيك مشان نبلش إن شاء الله بالشخص اللي بعده؟
Yes. So I'm just gonna skip those. But I wanted to give strategies to prevent burn. So I'll finish my last slide. So to prevent burnout, rest well. Make sure you optimize sleep by de-stressing, as I said, relaxing at night, and giving yourself good chance to sleep. Minimize caffeine at night so you can sleep well. We've talked about transitioning well between hospital, work, home. Nutrition, eat something that feeds your brain. Carbs tend to give you brain fog. Try to eat healthier, especially during the morning, maybe at night only one time. Exercise, even if it's 2 minutes. Yani when you're too stressed out, just do jumping jacks in the bathroom for 2 minutes and you'll be like, even if you're tired, as if you had a coffee without having a coffee. And then reflect every night. Reflect on how your day could go. And with that, I wanted to not take other people's time. Thank you. And I will leave the time for other people.
مشكورين كثير 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 دكتور مصعب. ويعني أعتقد هيك بحاسس جلسات أكثر من كل شيء حكيته، بده هيك لسه توسع أكثر عن كثير. كنا سعيدين بالحكي. الله يجزيكم خير يا رب. طيب إن شاء الله نحن رح نبلش بالفقرة اللي بعدها معنا الدكتورة بيان. دكتورة بيان هي حاليا خلصة اختصاص أطفال، وفيما بعد عملت بيدياتريك كارديولوجيست. هلا حاليا دايركتور لبيدياتريك اند كونجنتال ادولت كير بيونيفرسيتي اوف روشستر. مشكورة كثير دكتورة بيان على الانضمام لنا. بشكل عام اليوم إن شاء الله رح نكون عم نحكي عن الدكتورة بيان. يعني الموضوع هو كثير مهم، خاصة يعني مثل ما ذكروا الشباب كثير كنا نحن نركز إنه يعني هي مع بلد جديدة، فالسيستم الطبي، السيستم التعليمي، التعامل مع الناس مختلف. أيضا من الناحية الاجتماعية، من الناحية الدينية، هذا الأمر بالنسبة لنا مختلف خاصة كمسلمين. فكيف أنا بدي أكون عم أوازن ما بين هويتي إني أنا كمسلم وما بين أيضا إنه أنا عايشة في المشفى الدوام الطويل، كيف أنا أكون عم أعمل الواجبات الدينية، وأيضا كيف أكون آه، عم مثل حالي كمسلم ضمن البروجرام، بحيث ما إنه ذوب في المجتمع بنفس الوقت إنه أنا أكون مندمج في المجتمع، ما عم أكون يعني شخص غريب قدامهم. بالإضافة للشغلة الأخيرة هي كيف أنا أندمج في المجتمع المسلم والمجتمع العربي الموجود في أمريكا، وشو هي نصائح ليكون واحد يعني في الجالية، شخص فعال في الجالية، ويعني تكون هاي الجالية هو جزء منها وعم تساعده. أهلا وسهلا دكتورة. تفضلي يعني feel free to talk in English or Arabic whatever you want.
شكرا كثير عمر على النايس انترودكشن، وشكرا كثير لكل المنظمين اللي عملوا هالمجهود لينظموا الويبينارز والسيشنز، والصراحة أول شي بدي بارك لكل اللي داخلين على الماتش، يعني مثل ما بقولوا قطفتوا ثمار تعبكم وما شاء الله عليكم. متجتوا بأماكن جيدة، وإن شاء الله رحلة النجاح والتوفيق والسعادة تكون طريقكم. هو أكيد هاي المرحلة كتير بتكون ستريسفول، إنه أنت رح تدخل على شيء مجهول. مهما حاولت عملت روتيشن، مهما حاولت تعمل تقضي وقت بأمريكا، أو إذا ما كنت بأمريكا لسه بتكون أصعب. فإنه أنت شخص جديد بباك جراوند جديد بلغة مختلفة، ممكن ريليجن مختلف عنهم، فإنه تندمج مو سهل أبدا. وأكيد آم، رح يكون challenging، بس أكيد أنت بدك تعرف إنه هون مجتمع كثير بيتقبل الأجانب وعندهم انفتاح ليسمعوا أي شيء جديد. فحتى لو كنت أنت الأي ام جيس الوحيد بالبروجرام، overall they are open to listen and welcome you. And I can share like some strategies or something work out for me. بس رح أشوف إذا أكيد فيني أعمل شير للسكرين والبرزنتيشن، بس بدي أتأكد إنه عم بتشوفوا السكرين تبعي.
إيه دكتورة، شايفين الشاشة.
اوكي تمام ماشي حال. خليني بس ما متذكر هاي مشان آه. اوكي سو اعطوني موضوع مثل ما بقول controversial، بس انه اكيد محبوب للكل، انه قريب انت بدك تمثل حالك balancing face identity and belonging and residency. وانا بحس هذا الموضوع كتير مهم، ويمكن مثل ما شايفين انا بنت محجبة من الميدل ايست، عندي accent، فتاة. كل الأشياء اللي بتخليني stand out is different when I started in my pediatric residency, cardiology fellowship or interventional fellowship, which is like male dominant. Everyone know interventional cardiology is very male dominant. So having a female with like headscarf, Middle Eastern was like exceptionally rare find. So I can't tell you what work and why it's matter. ما شاء الله الدكتور مصعب قدم presentation كتير رائعة على ال residency is intense and I will build on what he talk about. يعني لأنه يعني حكى كتير كلام جميل، إنه هو وقت رح يكون فيه كتير ضغط عليكم. وهذا بيأثر على أنت كتير مهم تعمل كل شيء. هو الريزنسي أصلا فيه ضغط ووقت طويل، بيأثر عليك نموك شخصيا وبروفيشنال. فأنت كتير مهم تعمل الأشياء اللي أنت مثل ما بقولوا مخرج أو شيء مهم لإلك أو تنفيذ بالمعنى الآخر. مثل ما قلنا اللونج اورز هاي ستريس، والمرات لما بيكون عندك مشكلة ايدنتيتي انه انت تثبت وجودك بالقسم اللي انت عم تشتغل فيه، بالاضافة للستريس of the work that everyone is encountering is adding burden to you. الفيس اوف كلتشر هو مشكلتين، اما رح يكون لك السورس اوف سترينث، اما هو رح يكون الشيء اللي يقويك اللي يخليك تطلع من الريزنسي بشكل اقوى، او مرات بيكون added stress to you. ونحن ما بدنا يكون added stress to you، تقعد تفكر انه انا بدي اصلي بدي صوم، بدنا نحكي على الاشياء اللي بعدها، انه يكون شيء مسبب لك ضغط نفسي اكثر. وأهم شيء إنه حتى الدراسات، دكتور مصعب حكى بهذا الشيء، والأشياء كثير حكت إنه لما أنت feeling belong، لما أنت بتشوف حاسس حالك respected and represented، أول شيء الويل being بيكون عندك أفضل، رح يقلل البيرن أوت، وحتى البرفورمانس إنجازك، وحتى إنجازك ونجاحك بيكون بشكل أفضل بالبروجرام. فهذا مو بس لأنه أنت عم تمارس دينك، بالعكس بينعكس عليك كإنجاز وبرودكتيفيتي بيكون بشكل أفضل. هلا أنا بس بدي أحدد إنه إيش هن الأشياء اللي نحن بدنا نحكي فيها. أول شيء هو الفيث هو كل إنسان حسب الديانة اللي هو بيآمن فيها، بيختلف الأديان أو الأشياء اللي هو spiritual belief اللي أنت بتآمن فيه. الايدنتيتي اللي هو أنت شو هو اللي بيمثلك، مين هو الباك جراوند تبعك، مين هو الجندر تبعك، مين هو الكالتشر تبعك. هو كمان identity إنه أنت what's your identity is you feel representing in your identity. والبيلونجينج يعني أنت تحس حالك إنه مقبول بالمجتمع اللي أنت حاسس فيه، مقبول ضمن الأصدقاء، ضمن الريزدنت، ضمن المنتورز اللي أنت الجروب اللي عم تشتغل معه. لذلك كتير مهم نساعد إنه توفر هدول الثلاثة بالنسبة لك. هلا التشالنجز بالريزيدنسي انا قسمتهم حسب انه ليش هن بيكون تشالنجز لما تكون انت شخص جاي غريب، خصوصي من ناحيه انه عندك ديانه مختلفه او باك جراوند مختلفين. اول شيء لانه احنا مثلا اذا كنت انسان مسلم فبيكون عندك هوليداي مختلفه، اوقات صلاه مختلفه، عندك شهر كامل بتصوم فيه، عندنا فترات الاعياد اللي بتختلف عن فترات الاعياد. فانت اهتماماتك الدينيه او احتفالاتك المهمه بالنسبه لك بتختلف عنه. الشغلة التانية إنه مرات ما بيكون عندك عندك أشخاص ثانيين بنفس الباك جراوند تبعتك، فهن ما بيعرفوا، ما عندك representative before، أو عندهم difficulty to understand your culture. ما حدا بيعرف، اللي بيشوفوه بس هو عبارة عن الأخبار اللي بتنشره أو اللي شافوه بالأفلام أو المسلسلات، فممكن غالبا ما بيكون واقع أو ممثل حقيقي لنا. مرات تاني بسبب إنه البريفيوس ايمج اللي عندهم اياها، مرات بيسموه هون مايكرو اجريشن، انه تعامل مو لطيف بيكون اما بشكل مباشر او بشكل غير مباشر، بشكل تعامل مسموم، تعليقات بتكون مثلا مزعجة لك بطريقة مباشرة او اخرى. فهذا الشيء بتولد اثناء الريزنسي ومعروف ومنتشر كتير. الشغله الثالثه انه انت لما بتحس حالك انه انت ما عم تحسن تتواصل معهم، you cannot fit in، يعني ما عم تحسن تفتح مواضيع أو تندمج معهم حتى تكون productive وتكون كجزء من مجموعة عمل وجروب. الشغلة الثالثة لما أنت بتحس حالك إنه دايما صامت بأي شيء بيتعلق بالدين، مثلا لما بيحكوا على مثلا نفرض أجا مريض مسلم بشهر رمضان، فأنت دايما بتحاول تصمت أو تخبي إنه أنت مسلم، أو تحاول تشرح لهم، أو تحاول مثلا تحس حالك إنه دايما isolated، أو دايما بتكون حاسس حالك إنه ما عم تحسن تعبر أو advocate for your patient based on the background that you have similar to him. هلا ليش كتير مهم، أنا كتير مهم يعني نحكي بهالموضوع، إنه تحس حالك إنه supportive and you are well presented، لأنه as I mentioned هو ال source of purpose of motivation. لما بيكون عندك أنت إيمان إنه أنت الشيء اللي عم تشتغله معالجة المرضى، نحن دايما reflect on that in our religion، إنه مين ما كان الريليجن تبعك إنه دايما فيه شفاء الناس، معالجة الناس، تخفيف الألم، هذا كله ثواب. فبالنسبة لأنه هو مو بس عبارة عن عمل جهد، هو عبارة عن ثواب بنفس الوقت. فهذا دايما بيعطينا relief إنه at the end of the day I save someone's life, I feel rewarded, I feel established, I felt very good about myself, not because I did that 12-hour shift, no, because I saved 3 people's life, I saved this father who have 3 kids. I can, like, all this rewarding feeling is good to be help you to feel established and well successful. الشغلة الثانية إنه أنت بيخليك resilient. الريزنسي فيها كتير أوقات نفقد مريض أو بيصير complication أو bad outcome، فدايما أنت مثل ما بقولوا بسموها debrief. فكل شخص عنده debrief معين. في بعض الأشخاص أنا بصلي بحس حالي تواصلت مع ربي، بحس حالي ارتحت، فهي وسيلة من تواصل الدبريف اللي تبعتك هو عن طريق الديانة تبعتك. كتير إنسان أشخاص بيعملوا له يكون دبريف إنه يفرغ عن طاقته، يشكي همومه لربه وهالأشياء، وهو وسيلة كتير مهمة تستعملها أو تمارسها أثناء الريزيدنسي. الشغلة الثالثة إنه بتساعدك لتاخد قرارات مثل ما بقولوا ethical right، يعني عندك قواعد إنه ما ممكن تخطاها، ما ممكن تكذب، ما ممكن تأذي، ما ممكن تخبي، ممكن manipulate، لأنه نحن عنا بداياتنا أو background is something unacceptable. It is unacceptable universally, but when you feel like it's supported by your background and religion make you even more stronger. الشغلة الثانية إنه دايما أنت بدك تحاول تحس إنه your face and identity should be integrated what you are doing. لازم يكون جزء من أجزاء الأشياء تعاملك اليومي، مو شيء دايما أنت عم تحاول تخبيه أو تحاول تتهرب منه أو تحاول تحس حالك بإحراج إنه كيف بدك تطبقه. فهون أنا رح أحكي هلأ شوي على خطوات عملية إنه ممكن تساعدكم. يمكن في أشخاص بيعرفوها، ممكن أشخاص لا، إنه كيف نحن. طيب أنا رح أروح على الريزنسي وحكيتي لنا كل هالأشياء رح تواجهنا، كيف يمكننا إنه نتخطاها، أو like some ideas for that. في هون عنا بأمريكا، أنا ما بعرف اللي قديش عندكم داخلين على الريزنسي، بسموها institutional support. Every program, every institute have a lot of flyers to support the different people, different background, different religion. And one of them you should always ask about DEA, which is like diversity, inclusion, and diversity and inclusion. So they always have initiated all programs, and if it's a good residency program, they will brag about how they are inclusive and how much they are diverse in the program. So you should feel yourself as a strength to the program because you are representing their diversity. يعني عادة أنا لما كنت أروح على البرنامج لما بقولوا إنه نحن we are so diverse، and دايما بيحاولوا يطلعوا على إنه شوفوا نحن عندنا مثلا بنت من الميدل إيست، they are brag about their self، لأنه هلا هاي الأشياء بحاولوا حاليا ولو كان بالشكل الظاهر، ولكن بالحقيقة بيحاولوا يحاربوا ويحاولوا يظهروا إنه فيهن diverse و they are inclusive و they are welcoming all people، لأنه هذا ما بيرفلكت على الامبلوي، reflect on the patient. لأنه لما البيشنت بيشوف إنه الدكاترة مختلفين، فإذا جاي عنده مثلا مريض أسود أو مريض من الميدل إيست أو مريض مثلا عنده different belief، فبيحس إنه الدكاترة كمان diverse so they feel more safe to be treated in this place. بعدهم عدد ذلك في بالبروجرام بسموهم wellness team. أنا كنت واحدة من الأشخاص اللي كنت دايما involved in the wellness team. ليش هذا مهم؟ لأنه ال wellness team عادة بيختاروا 2 أو 3 resident من كل سنة، وهدول resident هن المسؤولين عن ينظموا مثلا dinner with together or lunch during the lectures or education things. كنت دايما استعمل هذا الويلنس تيم بكل الاوكيجن كانت اللي بتهمنا. مثلا جاي شهر رمضان، الشهر اللي قبله الويلنس تيم اروح انا ابعث لهم ايميل اقول لهم بمناسبة إنه شهر رمضان شهر الجاي وعنا wellness schedule for next month. I wanna have presentation for 10 minutes about Ramadan. What does it mean? What fasting mean? What's like what صلاة التراويح mean? When the patient is fasting, when the provider is fasting. فكنت حاول دايما educating them. At the same time, program support you as a funding if you wanna like bring something. I usually brought like Middle Eastern sweet. So بخليها إنه مثل يعني العالم عم تاكل وعم تسمع البرزنتيشن وبنفس الوقت أنا أعطيتهم فكرة شو هو رمضان. فلما رح يبلش شهر رمضان هن بيعرفوا إنه أنا رح أصوم من هذا الوقت لهذا الوقت. أنا مثلا ممكن أثناء المسا تشوفوني عم بصوم بس عم بصلي، بس هذا مثلا عنا اسمه صلاة التراويح. أو المريض ممكن مثلا يجي صايم أو نحاول نظبط له أدويته. فكان كتير طريقة إنه إذا بتحسنوا getting involved بالwellness team at the beginning and be always speak up when you have an idea. الشغل التاني حاولوا تدوروا على حدا peer or support. كتير مهم إذا في لما دخلت على البروجرام إذا في حدا من السنة الثانية أو السنة الثالثة من السودان، من مصر، من مثلا باكستان. they are Muslim, they have background. always connect with them, ask them well, like شو بتعمل community هون، شو بتحتفلوا بالعيد وين تروحوا على الجوامع، كيف تاخدوا عطل أثناء العيد. حاول دايما تشوف مين السبورت تبعونك بالبروجرام أو من المنتورز. يعني مرات حتى ممكن تطلع على منتور وتشوف مين هو اللي مثلا من نفس الباك جراوند هو can understand you. Again مثل ما قلت لك participate in leadership modeling and inclusive. الموضوع مثلا مثل ما حكينا إذا في wellness program I highly encourage you to be included in. At the same time when they have something be always thoughtful. For example لنفرض عندك صديقك هندي، فأنت مثلا كونك بالwellness program send them an email where it's like hey do you have any occasion you want to celebrate and you want to talk about. So هن ما بيحسوا إنه أنت بس focus on yourself, you are feeling other and support them. so لما أنت بتحكي عن نفسك ما بيحسوا إنه كل الموضوع عنك فأنت you are encouraging diversity or encouraging inclusion and they love it. هن معظم الأحيان لما أنا بكون بحضر هدول الأشياء بالأخير بيقولوا لي إنه إحنا كنا مبسوطين كتير، علمتينا على شيء جديد، نحن ما كنا بنعرف هيك تحتفلوا، ما كنا بنعرف إنه قديش أهمية هذا الشيء لإلكم وإلى ما هنالك. مثلا موضوع الصلاة، أنا موضوع الصلاة كان مثلا بالنسبة لي كان إنه مثلا حاول تشوف مواعيد محددة. lunch break if you can take a lunch break and then tell them hey for 5 minutes included in my lunch break I will try to pray. So always be like thoughtful and be open conversation with them. Always have like hey I want to do what extra work, what needs to be done by this certain time or make sure it's done, and then I will take this 10 minutes or 15 minutes lunch break and during that time I will coordinate it by the time I can do prayers. لا إذا مثلا الأذان بيأذن الساعة 1 فكنت أخذ لانش بريك مثلا من الساعة 1 ل1 وربع، فإنه ضمنت إنه بهالفترة بحسن صلي وأخذت اللانش بريك. ما معقول أخذ لانش بريك مثلا من الساعة 12 ولما peak of the work at 1 I told them I want to take another break for prayers. So always be thoughtful about the time you can manage your schedule to fit your prayers, your belief, your participation at the same time included in your break. So it's just negotiating with them and be open about it from the beginning. The other thing, as I mentioned, ask for flexible scheduling. There's important event. إذا عندك عيد مثلا أنا بعرف العيد رح يجي بعد 3 أيام أو بعد 10 أيام، حاول تقول لهم ممكن آخذ هذا الداي أوف. جاي رمضان مثلا بشهر أبريل السنة الجاي ممكن تقول لهم أنا بشهر أبريل ممكن تحطوني على elective or clinical. أنا بفضل هن دايما بيسألوك if you have preference أو أنا مثلا بدي أتزوج أو أنا عندي holiday أو أنا. فكتير مهم إنه you can think about your holidays ahead of time and request it ahead of time. If you have certain celebration, whatever, you should say, hey, I'm having Ramadan, I would prefer to be like on night call. So I do the work on the night or sleep throughout the day or etc. different things. So they send usually schedule request ahead of time. Be careful and be thoughtful about what you are care about, what holiday you want to take time off, and try to ask them in advance, because they can change a schedule in advance. But a day prior, say like, oh, I just discovered, or like, oh, it's today Eid, I'm taking a day off. You change the schedule. يعني غيرت كل المواعيد راح يتخربطوا. والشغلة الثانية دايما أنا بتذكر خلال residency والفellowship I took calls for all Christmas for 6 years. I was like 7 years. I was taking Christmas calls all over. So أنت لما بتاخد من عندهم Christmas وهن بيكونوا عم يتقاتلوا إنه مين بده ياخذوا Christmas، إذا كنت مثلا أنت مسلم، فلما بتطلب الهوليداي تبعتك اللي هي fit outside of their holiday, everyone will say yes because you cover them for Christmas. إذا أنت مثلا إنسان مثلا مسيحي وبدك تاخذ الكريسماس، فيك تقول لهم مثلا باخذ أنا هاي السنة الكريسماس but next year I would like to have it off. So always be negotiate with them and always offer them before you request. فأنت دايما حاول تكون أنت الشخص اللي offer help. So when you ask for help or you ask for your ask, it will be always answered with like okay. The other thing is find a mentorship. كتير مهم. أنا بلشت residency كمان ما كان كتير diverse، فأنا حاولت أشوف فلقيت إنه ال ID infectious disease outside of my department, outside of my work. He was like Pakistani who's very well known, so he's كتير كبير بالجالية. فرحت تواصلت معه قلت له أنا جاي هون جديد، شو بيصير عندكم فعاليات، احتفاليات العيد، احتفاليات رمضان. فكان كتير سهل إنه يوصلني مع الأشخاص. فكان دايما text me whenever there's occasion or something, hey this is what's happening, come join us for this and come join us for this. لأنه أنت لما بالأخير بتروح مع هدول الأشخاص your battle will be felt. يعني أنت رح تحط energy من جديد، رح تحس حالك refresh, you like connect with people same background, you have the same things, so don't feel embarrassed about practicing your belief. But again, my two cents about that is first of all offer help first and then ask your ask, then they will receive always with positive feedback. So strategy, as I mentioned, be intentional about your boundaries and self-care. اعمل جهد، لأنه هن ما رح يعرفوا، ما رح يتوقعوا قيمة الهوليدي تبعينك، ما رح يتوقعوا قيمة الرمضان تبعك. أنت be intentional and speak up about yourself and about your care. The other thing I want to say about, I don't know if there is females or on the call or wearing hijab. بالنسبة لي أنا شخص مثلا بعمل procedures، واحدة من الأشياء إنه I was intentional إنه أنا بيهمني آخذ disposable. أنا ما بس يعني حتى الهيد كاب للميل doesn't fit female، يعني حتى الفيميل surgeon بيقول لك إنه الهيد كاب doesn't cover. بالأخير شفت إنه النيورو surgeon عندهم large cap and cover the neck. So I asked them to bring me a box for the neurosurgeon head cap, and they were provided because I make my homework, I look up what alternative it can be provided and provide them, and they were so okay to order it for me and have it ready for me for use. So be intentional, make the effort and suggest it for them, and they will always receive it with back. Another thing, as I mentioned, find community inside and outside the hospital, either from your senior resident, mentors, or outside the community. And again, always identify who's like will be on your side and a mentor who support you when you have, for example, significant occasion. And again, I always say speak up when it's safe, when it's like appropriate occasion and you are in casual conversation, you can speak about your background, about your belief, about your holiday, and educate when possible. Whenever an occasion, just educate them about what your background, what does it matter to you, what does it mean, how can I take time off, how can I celebrate this, and engage them to know you better. And again, accept that balance is dynamic and evolving. You might not get every holiday off. ما رح تاخد كل عيد off. Accept it. It's okay. It's okay not to take every Eid off. It's like very intense time. It's okay if you get 1 or 2 Eids off during the residency and the rest is not. But at the end of the day, just try to like make effort to integrate your background into your training. And again, I believe I'm just finishing up. Face and identity is a part of whole person, and they should not kept at the hospital door. So you should come as a whole person to the hospital and live as a whole person. And again, belonging, as I mentioned, improve your learning, improve your performance, and improve your well-being. And its balance is always possible and powerful. So I wish you best of luck. I try to make it quick and smooth, and I'm happy to answer any questions for you guys.
الله يعطيكم العافية يا رب دكتورة، يعني كان برزنتيشن شامل كامل كثير مفيد. إن شاء الله رح ناخذ الأسئلة بعد فترة الدكتورة مريم. معنا الدكتورة مريم الخبصة، هي خريجة جامعة دمشق، عملت ريزيدنسي internal medicine في شيكاغو. هلا حاليا هي كارديولوجي فيلو بنبراسكا. إن شاء الله رح تكون تحكي مع دكتور مريم عن موضوع التواصل. بصراحة يعني نحن حتى أحيانا بين بعضنا، يعني بين مدينة ومدينة الواحد بيسافر، يعني بكون كل مدينة عم تواصل بشكل معين، أو بسافر على بلد تاني حتى لو كنا عم نحكي عربي، إنه أهل هاي البلد ممكن يفهموا هاي الكلمة بشكل مختلف. يعني نحن رح نكون عم نتواصل بلغة غير اللغة الأم تبعيتنا. الواحد ما كان قارن من الكتب، شايف من الأفلام، بضل يعني الحياة الواقعية غير. إن شاء الله يعني مريم رح تكون تحكي لنا على هاي الأمور بشكل أكبر. الله يجزيك الخير يا رب مريم على قد تفضل.
جزاكم الله كل خير على المشروع الطيب والأفكار الخلاقة. حقيقة يعني هي واحدة من أهم المشاريع اللي بتعين ال new trainees how to get involved into the healthcare system effectively. And it's one of the nice talks that I'm happy to share. I would say a few ideas that I came across. هي شغلة يمكن you wish you have been told before you start, and it makes a lot of difference in your life moving on. If we can call it the hidden curriculum that nobody will often teach you about it, but everybody notices. Hello. Keep in mind that medicine is often universal, but healthcare culture is not. One thing to keep in mind, for example, responsiveness is often interpreted as a professionalism. So in many countries, the expertise is the primary currency, which basically like how expert, how knowledgeable, how well you know. In the US hospitals, it's not only about the expertise, but rather how well you do respond to the staff, to the colleagues, and how well you're able to communicate with them. So, for example, if a brilliant physician who is not able to answer the pages will often develop a poor reputation, and the average one who is often reliable will become highly trustable. So people would often notice if you give them a call back about a concern, for example, about a dosage of electrolyte replenishment, dosage of a treatment, whether it's antibiotic, regular dose of a medication that you're resuming from the prior to admission. Did you show up when they raised a concern or paged you about something? And did you follow up through on their concern or a lab that you requested? It's true that the actual allied staff may not know as much medicine as you do. However, they will know whether you can be called back or not, and if they will reach out to you or not. And that's all credited to your professionalism. The second curriculum that we can also discuss, or the unwritten rule, being nice is not being actually superficial. So this is kind of also different in cultures. Since we do live in multinational, I would say, states, many international, I would say, graduates or trainees or clinicians would often think that the US culture may often rely on pleasantries, like, for example, making sure that everyone is pleasant around you, sharing good mornings for everyone. How was your weekend? How things are going? How was the graduation for your son? These things actually, it's not about doing an efficient type of work, but rather in the US workplace, it's actually credited as you acknowledge the person in front of you as a human being, not rather just a function. Because often ignoring this unintentionally will make someone feel distant and arrogant, which we totally would not like to give that reputation for your starting point. Third thing that also came to my mind, keep that the best clinicians are often the easiest one to be approached. It's kind of, I would say, fascinating that pretty much the one who intimidates everyone as a provider will often appear powerful. However, the one that everybody will feel comfortable calling no matter what time, they are actually the one who will make the practical influence in healthcare. In the US, just keep in mind that accessibility is very highly valued. I cannot emphasize this enough. Like any kind of concern can be raised anytime. Being approachable rather than defensive, arrogant, or questioning the rationale behind it all comes to your credit. So if someone is worried about a patient and they ask you to come to bedside for evaluation, I would encourage not ignoring that call, or I would say dismissing it, or try just to sway away from it, but rather just show up for them and value their concern and try to come up with practical solutions at the same time. Fourth thing to keep in mind, disagreement is often expected. As we all know, we often come from different healthcare systems, and often arguing with a senior physician is not usual. In the US, it's kind of different setting when you're actually in a rounds, whether in the ICU or general medicine, IM table rounds. You'll have different healthcare specialists. You'll have sometimes the respiratory therapist that's arguing your regimen, the pharmacist arguing your regimen, nurse arguing your regimen or discharge, or sometimes a medical student has a question. All these ideas or perspectives are valid and should be taken into consideration. And it's often viewed as an advocacy for patient care. So it's pretty much like, I would say, advocate for the patient care, consider all the opinions and try to come with a rationale behind the strategy. Medicine is often not a straight line or one single approach that cannot be deviated. For the most part, you can come across good, I would say, outcome considering different option, or I would say gradual regimen as well. Other thing to keep in mind is that confidence and certainty does not mean the same thing. You will often get called about a lot of things that you may not have the final idea of what's going on with the patient. That's okay. You don't have to be certain 100%, and you don't have to make up things. However, the way that you can actually talk to the staff that this is your thought process and this is what we are considering and we will see and reassess is often valued, rather than just showing a lot of uncertainty at one point and emphasizing on a lot of phrases that will be less favorable. For example, adding a lot of perhaps, maybe, it could be, potentially, those will often be perceived as uncertain kind of thought process and will not be credited for your end. The sweet spot will be always like, this is what I believe, this is our valid concern, current assessment, and we may revise it later. So just keep that in your mind. Also, it's very important to keep in mind that nurses also are evaluating you. All technicians and alliance staff also are evaluating you. It might be harsh when we think about it from other perspectives. However, the questions that they will keep in your mind: did you really listen? Did you get defensive when they reached out to you? Did you explain the decision? Or did you have a respect to their bedside concerns? Nurse may decide whether they can trust you for the next interaction or not. It doesn't hurt that you actually do not have, as we said, you're not gonna join residency with the best medical knowledge, the most, I would say, confident approach. This is something that's gonna be built up on time. However, attitude will be always the thing that will never be forgotten for a trainee. Also keep in mind that they will be evaluating how you would respond to a different, I would say, interaction with patients' backgrounds. If a patient would refuse certain treatment, did you get a chance to explain the rationale behind your decision and to understand what is their reservation against it? Is it something culture? Is it a family boundary waiting for a decision? Is it religious background? Is it something that you can find a solution in between? Is it more of a, I would say, financial restraints? Just make sure that you cover the basics and have an open-ended discussion rather than focusing on your approach has to be valid at one point. All right. The seventh point that also came to my mind, people always remember how you react under pressure. I guess like most of us will go into a situation where they will called for rapid response, crashing patients. Sometimes you will have some rotations in the emergency. again, nobody will expect a perfection. It's all about the attitude, and how would, for example, you would break a bad news, unexpected deterioration, how you handle a conflict, or if you have a mistake. When the stress actually rises, here the culture becomes visible. Did you become more dismissive? Did you blame other staff members? Did you stay calm? Were you able to, I would say, share the workload effectively in a critical situation? Did you ask for help when it was actually needed? This is how you build your strong reputation in the difficult times. And it's never about your accent. We're all international graduates. It's always about your attitude. We often worry so much about our grammar, word selection, accent, that they understand. Those are valid concerns. We're not actually underestimating it. However, it's all about how you show up for the different culture. Are you respectful? Are you prepared? Are you open for different ideas? Are you reliable? And are you coachable at the same time? Character is all what they would remember in the end. And nobody would expect you to know everything about the American culture from day one. However, what would be frustrating is not the unfamiliarity, but rather unwilling to learn. This is a huge difference. Dismissing one of the, I would say, major cultural difference we have to respect, that basically as we do celebrate our own, I would say, holidays, they have their own, and you are expected as well to respect theirs. You don't have to be completely, I would say, swaying from your natives, or as Dr. Bayan was saying, to forget your identity. However, you can blend in and you can make a difference. You can literally say anytime if you have, for example, something new that you are trying to learn. It's not only about let's say, cultural difference, let's say about a work kind of workflow. If you're new to the system, new to Epic or a different healthcare software, it doesn't hurt just to say that I'm new to this system. Would you help me understand how things usually get done over here? Most people would respond to this positively, and they will credit you for asking for help. It's not going to happen every single time, obviously. It's going to be based on occasions, but rather than you're just, I would say, not willing to learn, it's actually showing up that you ask for help when needed. Also, keep in mind that we are in a position that will often learn from all the surroundings. You will learn the most from your patients. You will learn the most from your nursing staff, your RT, your attendings, your medical students, and your colleagues. So it's a learning curve from everyone. And again, emphasizing on what Dr. Bayan was saying, your difference is often an advantage. As we come from different healthcare systems, most of us often practiced in a resource-limited settings, and we were able to navigate different cultures, different beliefs, different languages. We were able to find our way through. And with time, you would often develop adaptability. This is a huge credit for the trainees that they would come from overseas. They will often be able to serve as connectors between different cultures. Keep in mind, those are always strengths, and the goal is not to have assimilation, but rather an effective contribution to the healthcare system. I guess those are all what I have for today. In terms of medical terms, slangs, we have plenty of resources. الشباب الله يعطيهم العافية يعني ما قصروا. I cannot emphasize enough on having, I would say, your favorite TV show or podcast that you can use so that you will familiarize yourself with the slang, different phrases, what does it mean? But keep the professional side no matter what. Never give a negative comment about a patient or a nursing staff or a provider to anyone in the hospital. Happy to get any questions, and thank you for having me again.
شكرا كثير مريم، يعني كثير 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 نصائح مهمة ومفيدة. طيب معنا نحن هلا 10 دقائق. إذا حدا عنده أي سؤال ممكن تحطوه بالشات، أو ممكن ترفعوا إيدكم تسألوا أي شيء له علاقة معنا. الله يجزيك خير دكتور مصعب لساته معنا الدكتور بيان، معنا الدكتور مريم. آم، أي سؤال استفسار؟ طيب أنا راح استفتح الموضوع. آم، كيف تتعاملوا مع موضوع لما يعني هو بشكل أساسي داخل المشفى، يعني قليل لا يمرق مواقف اللي بتكون ممكن الواحد منافي لمعتقداته، ولكن كثير من الأحيان بيكون في سوشيال ايفنتس، مثلا رايحين انتوا على مؤتمر، أو مثلا بهاي فترة الأورينتيشن بيكون في سوشيال ايفنتس. معظم هاي السوشيال ايفنتس هي بتكون خارج المشفى، وبتكون أحيانا فيها شغلات الواحد بيعكس معتقداته، كان موضوع مشروب، أو كان مثلا أحيانا موضوع الجلسات، أو مثلا المصافحة، أو أحيانا يعني بكون يعني بعض الأصدقاء متحمسين يجوا بدهم يضموك. كيف تتعامل مع هاي المواقف؟ يعني أنا عارف ما في جواب صح أو غلط، لكن يعني كيف هيك أكثر شيء الواحد يكون عم يتعامل فيها بحيث ما يطلع غريب، لأنه يعني هن جايين من طيبة قلب، لكن بنفس الوقت الواحد كيف يحط حدود بحيث يعني ما تصير عادي عند يعني إنك أنت ما عندك حدود.
أم أول شيء يعني هون بالسيستم أمريكا they will not fault you or like ding your chances by standing up for your values. أم يعني في خلاف على شغلة المصافحة، لأنه بالغرب شوي غير الانتنشن يعني أنت طبعا تعرف شو بقلبك، ففي شوية خلاف عليها حتى لما واحد كبير. بس أنا يعني بشكل عام بقول لهم لما بيحاولوا يعني بدهم يضموك، بقول لهم أنا أي شيك هاند، يعني بتمد إيدك. يعني في ناس حتى أمريكان ما بيحبوا الضم وهالقصص هاي. أنت حر يعني. when there is a social event it's up to you if something against your belief. إذا مانك قاعد على private room with something يعني you don't participate in buying or being or يعني you could always be شو بيسموها، إذا كلهم قاعدين وواحد أو اثنين عم بيشربوا، هاي شغلة يعني شغلة فردية. ما أنا بس مثلا بدك تطلع على there's different situation different issues يعني you don't have to join السوشيال events. you don't have to never have to. بيفضلوا انه والله خاصة اذا بدك بوزيشن هنيك بدك تشتغل معهم بعدين after residency they would like somebody who's open يعني to be social with them. You could always invite them to a neutral place يعني وتقول لهم أنا I just don't drink and I would respect your هذا. and you people respect by the way people that stand for their values يعني. I was in at some point 10 years ago with a group with networking and I taught everybody that I only shake hands. يعني إنه كله كله hugging fest تلاقيه. بس they respect you, they understand who you are and what you stand for, and there's no shame or shyness in just being who you are. That's just what I think about it. So stand up for your value, live powerfully and be proud. يعني كلهم تلاقيهم proud بيلبسوا their dress code. هلا ابني بيحط الطاقية وما ما بيطلع بالعيد غير نروح على المطعم الغربي ولابس جبة وطالع طاقية. He doesn't care what I يعني it's not about I don't care. I respect you whatever you wanna wear and I wear whatever I wanna wear. ف yeah.
الله يجزيكم خير يا دكتور مصعب. دكتورة بيان، دكتورة مريم، بدكم تضيفوا شيء؟
هلا مثل ما حكى الدكتور مصطفى، فيك انت تخبرهم من البدايه انه انت what's like your boundaries. هلا كوني انا حاليا ستاف مثلا على سبيل المثال، لما بيجي occasion وبعزم الستاف تبعي بقول لهم انا just invite you for dinner and drink. يعني I make it clear to them انه مثلا او لما كنت مثلا اطلع اقول لهم اي شيء مثلا فيه alcohol or like order food so صار يحاول دايما يكون في vegetarian option if I'm included if رايحين على بارك او رايحين على شيء فيك مثلا هون كثير حفلات بتصير مثلا غالبا اذا كان حفلات تخرج او كذا بتكون كثير professional you can go there وعادة هن الريزنت اذا بدهم مثلا يروحوا مشروب عادة بيروحوا بعد after party what they call it and they go to the bar or something you can include yourself in that situation when you feel like it will be more professional and there's not a lot of thing like drinking or something but most occasion would happen inside the hospital or like at like family friendly level I feel like it is I felt always acceptable and always like comfortable attending that when they go to the bar it's like I don't drink so I don't see myself going with you guys so I make it clear and don't feel like any pushback or negative sequela they always like try to arrange stuff like cinema movie night or dinner in like casual place or restaurant than going to the bar just because I'm attending or joining.
الله يجزيكم خير يا دكتورة بيان. في أي سؤال تاني؟ في أي كان سؤال على الشات أو حدا يرفع إيده يعني feel free to ask anything يعني ما في سؤال ما مسموح. مريم بدك تضيف شيء؟
والله حقيقة مثل ما حكوا الدكاترة يعني الله يعطيهم العافية حقيقة it's straight to the point for the most time as they said they will perceive it positively if you respect your boundaries and you say it in a professional way and as long as you're not accusing them oh no I would not do that or shaming others for having different beliefs or different cultures. It's often respected. And you can have your own, I would say, food or dietary restrictions at the same table where they have whatever they want to have. It's totally fine. It's not about joining them for whatever they want to do. It depends on the social event. مثلا إذا حدا مثلا is it's more of a family kind of deal or special situation, yeah, you should actually go and join them, congratulate them, and have the positive attitude about it. You don't have to do whatever they're asking you, and they wouldn't force you as well to consider the same thing. So yeah, those are my intakes on these points.
الله يجزيك الخير يا رب مريم. طيب نحن نختتم الجلسة. أنا يعني متأكد عن هذه ذكروها الدكاترة يعني كتير مهم الواحد هون يعني يعرف الناس كيف تفكر ويتعامل بناء يعني هو قد ما بده يحافظ على قيمه وعاداته وتقاليده وبنفس الوقت يفهم الشخص المقابل لأنه في كتير شغلات ممكن نحن نصنع تقييم كيف أنت تحكي الشخص الثاني أو كيف ممكن يفكر عليك الشخص الثاني فهي بتكون مختلفة بالثقافة هون يعني هون الموضوع مثلا عن جد في تقبل بشكل كبير يعني حتى تقبل أكثر ما نحن الواحد ممكن يكون متخيله موضوع أنت شو معتقدك موضوع أنت شو دينك الموضوع الثاني موضوع التواصل موضوع الأخطاء واحد إذا عمل أي أخطاء فكثير مهم الواحد يعني يكون عم يشوف يتعلم أكبر قدر من المعلومات عن المجتمع كيف عم يفكر وكيف الثقافة هون بتساعده بشكل أكبر على الاندماج بشكل بنفس الوقت يكون هو محافظ على هويته محافظ على عاداته محافظ على ثقافته بحيث يعني ما هو ينعزل بنفس الوقت واحد ما يذوب طيب الله يجزيكم خير دكتور مصعب دكتورة بيان دكتورة مريم يعني كانت جلسة مليئة بالأفكار إن شاء الله يعني الجلسة الجاي بدي أعطي لأخي عبد الجليل الجلسة الجاي يعني الشيء هيك المميز فيها إنه كثير من الأسماء كنت أشوفهم أنا بالإنترفيوز السنة الماضية وهاي السنة فهلا هن صاروا متحدثين معنا ف يعني شيء بفرح القلب فتفضل أخي عبد الجليل.
يعطيك العافية دكتور عمر. So this session is going to be an open space for everyone to share their experiences and ask questions. So the session is going to be as following. So first, I will introduce myself. My name is Abdul Jalil Al-Raghib. I am a graduate from University of Sharjah, and I matched just like you guys in DMC Wayne State University in internal medicine program. And I'm very excited to start my training hopefully soon. And this session is going to be as following. So we have 4 different residents that are going to share their experiences with us. And I'm going to introduce each resident, and then they will share their experience within 5 to 10 minutes, a small talk. And then at the end of the session, we will have an open space where everyone can ask their questions. So our first speaker is going to be Abdulrahman Atasi. He is an internal medicine chief resident at Brookdale University Hospital and Medical Center, and he is a graduate from Ankara University. He has strong interest in oncology research and has contributed to several research projects in the field. Please welcome Dr. Abdulrahman Atasi.
Hello, everyone. Thank you so much for the organization. It's very nice work and efforts, and it's very helpful. I'm just gonna give like an honest and like quick experience from myself about what I think was important. So like in one line, I think the most important every intern should have is like being dependable, being honest, reachable, and like trying to improve every day. I know medicine is hard, but I think the system here is harder. Like on the first day, like try to learn the system, try to learn how you can like consult, like if you need to call the consultant, how you get CT scan, like how transporters come, and like how you can get things done. I think like the good intern is not the one who says like the rare diagnosis, but like the best intern is like the one who get like CT scans done, like knows what's going on with their patient, knows like the potassium, know if the consultant is aware of the consult, and like all of these stuff. And always like ask early. If you don't know anything, like ask, how can I do this? What should I do? How can I order this? Should I call this person? Should I call the lab to do the like blood draw or like all of these stuff? If you don't know anything, if you don't know something, don't act like you know it. Everyone appreciate questions, but if something like not being done, or like if something goes wrong, or if you placed like the wrong order, then you might get blamed about these. And always try to be nice to all the staff. Nurses are your best friend, like respiratory therapists, like pharmacists. All of these are very helpful. I'm working in your city, so like sometimes we have to draw blood, we have to do this and that. So like on my first day, I asked the nurse to help me, and like when you are nice to them, they can help you with a lot of stuff. They can even do like if you have a good relationship with them, like here in New York, we have phlebotomists, and if phlebotomist is not around, then you have to draw the blood. But if you have like good relationship with the staff, they might do it for you. So always try to develop like good relationship with the staff. And I'm not sure about other hospital, but like in my hospital, like try after you accumulate with the system, after you learn the system, try to be good like at something wanted in the hospital. So like in our hospital, like lines, we don't like have a line team. So like everyone needs someone to be good at lines. So if you are like good at placing lines using the ultrasound, then you'll become popular. Like everyone will speak nice about you. You will be able to help people, and then they will speak like very nicely about you, like bedside ultrasound, or all these, like whatever you think is like needed at your hospital, and then you have a good reputation. Also start planning for your career early. Don't panic. Like after you get to know the system, after you think that you are good with the system, then try to seek opportunities. Like try to see how try to learn what you want to do, how you can do it, make connections, start doing research. So like my honest advice, like in July, you don't have to impress people with like your medical knowledge. Everyone know that we are like learning now, but try always to be organized. Try always to know all your patients, to be honest, to be dependable. Like ask all the questions you want to ask. No one's gonna get mad at you for asking, but there are some expectations from you that you should do. So don't act like you know something if you don't know. And I think that's my short experience.
Thank you, Dr. Atasi. So our next speaker who is going to share their experience is Dr. Imad Tahhan. He is a first-year internal medicine resident at Wellington Regional Medical Center and a former research scholar at the Medical University of South Carolina and a graduate from Ain Shams University. He has a strong interest in cardiovascular research and academic medicine. Please welcome Dr. Imad Tahhan.
Thank you, Abdul and thank you all for this organization. And thank you, Abdulrahman. You spoke a lot of things that I want to speak. So one other thing I want to talk about being a professional and be on time. It's so important, for example, if you're starting from 6 to 6, just come at 5:45, 5:50, especially in the ICU rotation. So I remember one experience with my ICU attending. She was super happy that I came to the ICU before the senior. So she was super happy about that, and you always give a good impression. And it's so important about first impression with the ICU attendings, especially. Other thing, working as a team. So let's say I did one of the seniors or one of my co-intern did any mistake. Don't just throw him under the bus and say, "Yo, it's not me, it's him." We are always a team, people. So if I did something correct or good, it's all because of the team effort, not because of me. And similar for any mistakes. Other thing during presentation, let's say, so usually 2 interns, 1 senior, and 1 attending, you present, your co-intern presents. Don't interrupt the co-intern. Let's say the attending asks him one question, even if you know the answer, don't jump and say the answer. If the attending or the senior asks you, then yes, you can answer, but just don't interrupt your co-intern. Always try to defend him. Don't try to be looking more smart than him or answering questions. But it's so important to build a good connection with all your co-intern and seniors and attendings. Other thing about reading. So first few months, try to focus to being a good intern. Even if you are interested in cardiology, GI, whatever, I found some people, they are really good in cardiology. They know every single guidelines, but in general internal medicine and ID, GI, other specialties, they don't read or they don't care about it. Because you never know, you may end up being hospitalized few years, then apply for fellowship. So it's so important to follow all the internal medicine. It's okay to have interest in cardiology, GI, whatever, but you always have to focus on all the aspects of internal medicine, because at the end you are internal medicine residency, not cardiology residency or GI residency. So the best way for studying, I don't know if anyone mentioned about studying, you see the case and then you read about it. Then the information will be stuck. You will never forget the information. Always. So some programs they offer Mousab and UWord at the beginning of the second year. It's also important because actually Mousab they're asking you questions. I don't think you will see it in real life. Very specific about rheumatology or other stuff. It's important for the board and for your ITE score. Every year we do ITE. All the residents usually. And last thing, enjoy the journey. مثل ما بقول على الحلوة والمرة, enjoy it. It will end very fast. I remember last year I was here as an applicant. So it will end very fast and enjoy it. Try to make connection, make friends. Try to find some people similar to you, even if you are not similar. So for example, now I'm doing a group with pickleball. I used to play paddle in Egypt. Now I'm playing pickleball with my friends here. So just try to accommodate the environment here and enjoy the process. And congratulations everyone for the match.
Thank you, Dr. Tahhan. So our next speaker is going to be Dr. Chams Albachir. She is a second-year internal medicine resident at St. Vincent Hospital and a graduate of Al Faisal University. She has strong interest in endocrinology and medical education and mentorship. Please welcome Dr. Chams Albachir.
Assalamu alaikum. Thank you so much, Abdul for giving me the opportunity to speak to the incoming interns. First of all, congratulations to each and every one of you. We're all very proud of you and all the effort they've been putting in for the past couple years to be in this position. I want to start off with speaking a little bit about my experience. It might be something that you could relate to. And when I first came into intern year, I wanted to do everything perfectly. But I learned that residency isn't about being perfect at all. It's about showing up every day, learning from your mistakes, and becoming a little better each month. And one of the first things that really surprised me was how much support we get in the residency. As medical students, we're used to feeling like we're on the outside looking in, but suddenly you're the doctor responsible for patients, and that can be really intimidating. But I quickly learned that the residency is a team sport. Your co-interns, your senior residents, the attendings, even the nurses, the pharmacists, and the case managers, they're all on your side, and they all want you to succeed as well. The second thing that surprised me is that confidence doesn't usually come first as an intern. It comes after repeatedly doing something difficult multiple times. I kept waiting to feel ready before doing things independently, but readiness actually develops from experience. So try to focus on doing the hard things in the first 6 months. Even if it's going to take you more time, trust me, if it takes you more time the first time, it's going to be much easier later on, and it's going to be something that you could teach to your incoming juniors once you're the second year resident. And the biggest practical tip that I can give you is to try to develop a system that works for you. Each person works differently. So a system could be either a checklist, a patient list, or some sort of organization that helps you become more efficient, especially in wards. And if something goes wrong, it's usually because something was forgotten, rather than because somebody didn't know enough medicine. And try to ask for help early. I learned that strong residents aren't the ones that know everything. They're the ones who recognize when they don't know something and they ask. And I never really regretted asking for help. I did occasionally regret waiting too long to ask for help. The next tip that I can give you is to take ownership. One thing that I tried to do is treat every patient as my own responsibility. They were my patients, and the seniors and the attendings are helping me give them the best treatment. So if I ordered a test, I made sure that I followed up on it. If I consulted a service, I checked their recommendations and made sure that they saw the patient. If a family had questions, I tried to make sure that they got the answers that they needed. And then the next advice that I want to give you is to be kind. Residency is really hard. Everybody's going through something outside the hospital or even inside the hospital. The patients are having a tough time. The nurses are having a long shift. You're having a long shift. You're tired. Somebody else is hungry. So the relationships that you build in residency matter. So the nurses who taught me things, the seniors who supported me, the attendings who invested in me, and my co-interns who went through the same challenges that I did became one of the best parts of my intern year. And if I could go back and talk to myself on day one, I'd tell myself 3 main things. First of all, stop comparing yourself to everyone else. Everybody is on their own trajectory. Second, you are going to make mistakes, and that's okay. Learn from them and move forward. The biggest mistake is not learning from them and repeating them again. Third, trust the process. There will be days when you feel behind, overwhelmed, or not good enough, but almost everyone feels that way at some point. I mean, I know intern year was like one of the hardest years of my life, but also one of the most rewarding. I learned medicine, but more importantly, I also learned teamwork and how to become more resilient. If you care about your patients, work hard, please stay humble and keep learning. You'll do just fine.
Thank you, Doctor. So our final speaker is going to be Dr. Mohammad Zobi. He's a second year pediatric resident at Bronx Health System and a graduate of Jordan University of Science and Technology. He has a strong interest in medical education and mentorship. Please welcome Dr. Mohammad Zobi.
السلام عليكم. شكرا على الاستضافة.
عليكم السلام.
بعد النصائح مش عارف شو يحكي يعني. ما شاء الله ما خلوش نصيحة مفيدة لو حكوها. أنا راح أبدأ من مطرح ما دكتورة شمس توقفت عشان أركز على نقطة إنه المقارنات تضعف المجهود بشكل كبير يعني. أنا التحقت في البيدياتريك ريزيدنسي وأنا لا أملك أي خبرة سابقة في العمل. أنا كنت فريش جراد، فكان معنا الزملاء كلهم عندهم خبرة مسبقة في العمل، سواء بيدياتريك ريزيدنسي أو جي بي أو مشتغلين. فالمقارنة بالآخرين وهذه يعني أحيانا إحنا نميل بشكل تلقائي إلى المقارنة، وهي تظلم تبخس نفسك، يعني تقلل من قدرك وبتأثر على أدائك للأمام. بل بالعكس، هو إن الصح إنه الواحد يقارن نفسه كيف بدأ ولأي مستوى وصل. يعني خلي نفسك هي المعيار والأساس. التعلم البطيء مطلوب. يعني أنا لما بدأت أتعلم الأشياء كانت أشياء كثير لازم الواحد يتعلمها، واستيعابها ومضغها ما كانش موضوع بسيط. لكن الواحد يكون يعني ما يستعجلش الأشياء، يبقى كوريوس، يبقى يسأل أسئلة، يبقى يهتم، يساعد الآخرين إذا استطاع. هذا يعني مش كل الناس بيقدروا يعملوه، خصوصا الناس اللي المحتاج المساعدة وهو يقدم المساعدة. هذه فضيلة كبيرة يعني. ما تخلي مثل ما تفضلوا الدكاترة موضوع الأشياء الثانية، الديستراكشنز هذول يأثروا علينا، مثل موضوع الأكسنت، موضوع المهارة في اللغة. نعم، هذول الأشياء يعني أشياء كويسة ستأتي مع الوقت، لكن السترونج نوليدج، شباب كثير يجوا معي مصريين مثلا، مع كل الحب والود لهم، لكن الاكسنت تبعتهم صعب تحاكي الاكسنت الامريكيه. لكن بسبب السترونج فاندمنتال نولج اللي عندهم، بسبب انه عندهم اكسبيرينس قويه، اثبتوا نفسهم والناس حبتهم وصار لهم يعني ذكر طيب. بعد هيك مهم نكون لطيفين ونبتسم ونشارك الآخرين ونتفاعل معهم، بس بنفس الوقت المبادئ لازم تكون واضحة. وبنفس الوقت ما بدناش نكون إحنا مثل ما تفضلت الدكتورة بيان، لازم يكون لنا هوية، ما نكونش عبارة عن apologized Muslims هنا في البلد هاي. بل بالعكس، انت بامكانك تعمل الكثير، وبامكانك انك تعكس فكره رائعه عن ثقافتك. وكل ما انت كنت قوي، كل ما كان شخصيتك فيها قوه، كل ما كان اقتناع الناس فيك اكبر. على العكس، لما تكون انت ضعيف وهادي ودائما صوتك منخفض وكذا، نعم يمكن يوصفوك بانك لطيف، يمكن يوصفوك بانك، بس الناس، في شريحه من الناس تتاثر بالقوه. اذكر انه انا في المستشفى اللي احنا فيها لا يوجد فيها مصلى نصلي فيه للمسلمين، وهذا الكلام صار له يعني في اخوه مسلمين في المستشفى لهم 20 سنه، وما يعني ما كان في امكانيه يفتحوا مصلى. بس الحمد لله لما تواجدنا هون ونطالب بقوه، وحتى انا خضت مع الCIR وهي يونيتي بتمثل الريزيدنس هنا، كنا قادرين نفاوض على العقد تبعنا مع المستشفى انهم يعطونا مكان للصلاه. وهذا مش فضل منا، هذا فضل من الله، لكن الاسباب والسعي مهم. فانت لما تسعى وتثبت انك انت لك صوت بهذا البلد مسموع، هم هون كلهم بيقدروا الديمقراطيه، كلهم بيقدروا احترام الاخر، كلهم بيقدروا احترام الثقافات. طيب انا ليش اخفي ثقافتي؟ ليش اخفي عقيدتي؟ ليش اخفي هويتي؟ فبالعكس انا بقدمها بشكل كويس وايجابي ومقبول للاخر. مثل ما حكينا كمان، نقطة إنه يكون حواليك مجموعة أشخاص قويين وكويسين، إن واصبر نفسك مع الذين يدعون ربهم بالغداة والعشي. يعني لاقي لك مجموعة كويسة، اتعلم منهم، وكون بنفس الوقت هم السند لك وظهر لك، قوي نفسك فيه. مش غلط تكون مفتوح مع الكل، تطلع تسلم، تبتسم مع الجميع، لكن بالأخير خلي لك مجموعة على اطار ضيق شوي. هاي المجموعه اطلع وجي معها، خلي في تواصل مستمر معها، قوي علاقتك فيها بحيث هذول يصبحوا لك ظهير في المكان اللي انت فيه. الاعمال الصغيره، يعني من يفعل الخير لا يعدم جوازيه. يعني اعمال الصغيره احيانا احنا بنبخسها او بنفكر انها ما بتؤتيش ثمرها، او got unnoticed مثلا، لكن ما في شيء بيضيع يعني. كثير أشياء عملتها كنت أتوقع إنه عمل بسيط بتعود عليه وأنا من صغر يعني بيمثل بيتي، لكن الناس هون بتشوفها شيء كبير يعني. شكرا مرة ثانية. وهذا المكان سامز مكان عظيم، احنا دائما يعني نشعر بالامتنان له على أفضاله علينا، وشكرا على الاستضافة وجزاكم الله.
الله يعطيك العافية. شكرا جزيلا دكتور، شكرا جزيلا لكم جميعا. Now we have around like 15 minutes, 18 minutes left actually for open questions and open discussions. Anyone who feel free to ask any question, the floor is open. So if there are no questions, I can start by asking my own question. So as a new incoming intern, I'm not sure if everyone aware of the visa situation, especially for Syrians. Some of us are expected, hopefully not, but some of us are expected to reach a bit late. So some of us might miss the orientation. So what advice do you have for us if we miss the orientation on how to adapt very fast and overcome this gap?
انت قصدك على الناس اللي من برا امريكا ولا اللي من جوا على الجي 1 ريسيرش ورايحين اون على الجي 1 كلينيكال؟
Either wise, like there are many visa issues right now. Some have issues in change of status, some have issues in acquiring the visa from outside because of the Syrian nationality.
هلا اللي انا بعرفه في حدا صديق صار معه هديك السنه هي القصه، عمل شغله منيحه، استأذن من مكان الريسيرش وراح للمكان اللي هو ماتش فيه ريزيدنسي. طبعا هو هون ما بيحق له يمارس العمل، ما بيحق له يلمس البيشنت ولا اي شيء، لانه هو جي 1 ريسيرش، بس المستشفى وافق انه هو يتم معهم في الاورينتيشن. انه انت في الاورينتيشن ما بتعمل شيء حرفيا للبيشنت، فهذا ممكن يكون حل من الحلول، تستأذن من مكان الريسيرش وتروح على مكان الاورينتيشن اللي انت فيه. From outside US, Zoom. Some lectures they are on Zoom. So هذا أكثر شيء ممكن واحد ممكن يعمله. وفي فيديوهات على اليوتيوب، أنا ممكن أشير channel على اليوتيوب introduction for how to write a note, the system in the US, even epic videos, everything. You can also watch videos on YouTube.
شكرا جزيلا دكتور. يعني من خبرتكم يعني بشكل عام لو حدا تأخر بسبب الفيزا, is it like a big issue? How like tolerant are they with this?
I don't think it's going to be a big issue if they join in late. Everybody is understanding. They're going to help them out. They're going to teach them. They're going to hold their hand and show them every step. I don't think it's going to be a big issue, inshallah.
شكرا جزيلا. Anyone has any question?
I want to add one thing for the visa. If you are a latecomer, the issue will be with the internal medicine board committee. So you are not allowed to be absent from your training more than 105 days. So this is the problem for extension of training sometimes might happen. So if you are in, let's say, in our situation, in this institution where I'm doing my residency now, or done my residency, they did not take anybody on H1. They did not offer any H1 position for that reason, because it's taking forever. So I think you are safe until you get into the residency, not more than 4 months. The reason why I'm saying 4 months, because you will waiver your annual leave. You have 28 days. It depends on the residency. You'll waiver your vacation, and then you will end on time. But let's say if you get 5 or 6 month delay, I don't think your program will be able just to set you for the internal medicine board. So here there is one exception. If you did a residency outside the States and it was an ACGMEI, like in HMC or AUB, or I think in الجامعة الأمريكية بمصر أو ما شابه. In this situation, you can get waiver for at least 6 months up to 12 months. So that your program director should write a letter that you are meeting or exceeding the expectation for a first year resident or second year resident. Also, you have a previous training, and then I can guarantee this person is eligible for the board. So just that the delay will be working against your odds if you are more than 5 months in the calculation. And be aware that's one thing. They will ask you either to extend your training, or maybe you can do the waiver thing. The extension of the training will be against your odd again if you are applying for fellowship, because you will be graduated late, and then when you want to apply for fellowship, you are not set down. So you will lose kind of 5 to 6 months. And if you are on J1, here this is a problem, because there is no program will give you an extension, because you will reach to a level in 6 months after the you finish your residency and you are not in the fellowship. So it's kind of a thing you need to consider early, and if you will be coming late.
So what is the safest like the time zone like?
So
So we
that's
don't
what
break down.
exactly. Let's say a fresh graduate from Syria coming, or outside the states, or if you are in the state, most of the time you're safe, because most of the time it be the situation expedite. But if you are outside the state, let's say, and then you're coming in November, let's say, the first thing you need to negotiate with your program how we can solve the extension 105 days. So as I said, 105 is the limit. They might extend it up to 140. No. It's absolutely not more than 140 days away from training. So how you can do that, as I said, you need to just give away your annual leave, which is around 50, like around 60, 70 days. But you need to be mindful as well. 3 years working without an annual leave is kind of a hectic, and the burnout level is like so high. So that's the thing you need to figure out from your program. So I know some people, they did not come on time, and for 5, 6 months, and then they have a negotiation with the same program that they will be matched in the next year. Let's say they will save their spot, all right, in the program, because they will come late, and in J1, there is some kind of an area will not be covered. So they will save their spot, and they give them, when they tell you that your spot is saved, that's something you can believe them on that. You trust them on that. So they just postpone their joining date until the next academic year. I'm not saying this is the situation you should follow, but just you be aware about the time of extension, because we as IMG, we do not know about the days, how many days we should be in training, how we can waiver our days. There's some people, they not aware about the 140 or 105 days.
لا ما كنت بعرف شيء يعني الله
No,
يجزيك
no.
الخير.
Anyway, it's unfortunately it's very common, because the visa situation is taking
Yeah.
forever, And then the people, they were late last year in my program. Most of them, they waived their annual leave, and then I'm telling you, 36 month working without an annual leave, especially for you as an IMG coming to different country. And نحن Syrian, when we come to the States, we don't go outside, like for visiting or something. You need to consider imbalance. Like there's a lot of things you need to consider. Yeah.
And is like holding the position for the next year, is it a common
It
thing?
happens if the program promise you. Most of the time, it happens. When they tell you, they are not misleading you. They are just clear about that point. They want to start earlier, and you are clear with them. I mean, there is no tricks here. I mean, the program director, if they mentioned they want to fill the spot, they have no obligation from their side, by the way. They can take you, or they can just ditch the whole thing. But if they said they will consider taking you next year, I mean, this is another option you might think about.
Thank you. شكرا
Dr.
دكتور.
Naim, when you should ask him regarding that option?
When you feel like your visa, there is no hope after 3, 4 months from your residency.
Okay, gotcha. Thanks.
Yeah. This is a time you might start like negotiating with your program director that what do you think, maybe it will take more time, because if you can imagine joining a residency in January or February, you lost the half of the first year. How you could compensate if you are in J1? You might do some extension on J1. You can ask for an extension later on from your program, but I'm worrying about or concerned about the 6 month you will be off cycle, how you will apply for fellowship. So at that moment, you will be pushed to do a hospitalist job and do your waiver for your J1. Let's say you are your fellowship, you are interested in cardiology or GI, whatever, you cannot do the fellowship afterward. You need to go to a hospitalist job for H1 and waiver, Conrad waiver for 2-3 years, and afterward just then to secure your green card and come back. Just to avoid all this hustle, some people, they do not want to get into it. They want from the residency to the fellowship. So there is another choice. I'm not saying this is the best choice, but I'm saying one of the choices.
شكرا جزيلا دكتور. أي أسئلة؟ Any questions?
If you don't mind, Naim, you may know better in that situation because I remember we came across similar one in our program in residency. كان عنا واحد من residents also who joined late even before this hassle of visa. He got actually two options and yeah, they told him like he can join late as you said, or he can apply for the next year, reserving his spot, or if he wants to go to another program. So he was actually like having the choice if he want to consider the program again or if he would have his spot in the same program. يعني هن ما بيعملوا لك limitation بس بده يكون للأسف هي تكلفة مالية إنك تقدم على الماتش من أول وجديد وكل البروجرام كل البروجرامز basically. If you want to stay in the same spot, it's up to you. If you don't, that's a different situation.
صحيح صحيح. By the way, سلامات مريم.
No, it's so nice to see you here.
It's always nice to see you. All right. Any question, guys? If you have any question about, I mean, I'm not a visa expert, but because I'm an IMG, suffered for 8 years with the visa situation, so I might have some background.
So there is a question in the chat. Yeah. I'm sorry, Dr. You can go.
لا، عندي سؤال شوي بره الموضوع، بس انه موضوع الفيزا هل كمان شيء بأثر على ال H1B waiver بعد الريزيدنسي موضوع الفيزا، ولا هذا ما له علاقة؟
إذا أنت you are asking about HB1 waiver اللي هو كونراد waiver بدك تعمل الجي 1 waiver قصدك صح؟ أكيد بيأثر لأنه كونراد كمان هو مثل الماتش، وإن بدك تقدم على كونراد هو كمان في سبوت، ما كل العالم تقدر تقلب على H1 بعد الجي 1 بنفس الوقت، خاصة depends on their speciality. خلينا نقول some speciality مثلا مثل أنستيزيا وإلى آخره very rare to get a spot، يعني ممكن يكون في 30 كونراد spot بكل اليونايتد ستيتس. Internal medicine in general is easier because like or pediatrics or these specialties are kind of they need a lot of people. But I'm saying also when you apply to the Conrad, you have to wait for acceptance as well. So you might get it, you might not. If you did not get it, you have two choices: either extend your J1 for another fellowship, or you apply for 1 year, or it's called O1 visa. Which O1 visas most of the time it's kind of a hustle because it used to happen to switch from J1 to O1 inside the States. Recently, you might need to go to Mexico or to Canada, wherever, to apply again and get the fitting done. Because these things are evolving. But I'm saying J1 visa serve you for 7 years, the maximum extension. Let's say you are doing cardiology and interventional cardiology. This is 8 years sometimes. With the TAVR thing. So you might not be able to get the whole training done. You might ask for an extension, let's say from the ECVMG. They might say yes, might say no. But if it's no, you need to extend your training based on the O1 visa. This is the last resort for you, unless if you have a green card holder or whatever. Now the H1 thing, usually it's like a مفاضل يعني there are spots, you need to apply and then afterward you might get it, you might not, unfortunately.
And there was a question about the DS 2019, like, do we need to get a new one if we are late? I'm not sure if anyone can answer this question here.
DS 2019 be required if they are coming a few months after. No. I don't think you need to get a new DS. 2019 is coming from the ECVMG. The moment that you are in the States, you get your I-94 and then you will go to the ECVMG website and then just notify them you are there and you mention there's some insurance thing, and then you program notify the ECVMG and they will get the DS 2019 or either with you or with your program. But the DS 2019 usually it's an annual renewal, so you do not need to renew it in the middle of your residency.
Okay, shukran, Doctor. Any more questions? We still have 4 minutes.
شباب تعبوا اليوم. يعطيكم ألف عافية وكل الشكر للشباب اللي ضمونا والصبايا. وفعلا يعني أنا وقت فت على الريزدنسي ما كان في أصلا فكرة إنه يكون في جايد، يعني بتخيل you made the path like super easy for the people are joining. خاصة انه نحن من سوريا، خاصة الناس اللي عملوا الميديكال سكول بسوريا وطالعين على totally different culture, different language, everything different. يعني انا وقت اجيت لهون بتذكر وقت قالوا لي بي تي او تي بعد ستروك تحك راسي 3 مرات، شو هي بي تي او تي؟ يعني انا مين هدول الناس؟ هاي الابريفيشن وهي الشغلات البسيطه اللي بتفكر انه الناس هون بتعملها ريفلكسز، انا بالنسبه لي كانت تاخذ وقت لحتى اعرف شو عم بصير. او احلى شيء اني اعود اكتب نوت على سيرنر او على ابيك، انا كنت اكتب نوت على قلم وورقه. يعني انا وقت كنت راجعت السيده فلانه الفلانيه بشكايه 1 2 3، كتير صعب انك تعمل هذا البيج سويتش. يعني كل هدول اعطيه حالك وقت انك فعلا يعني امبريس الاكسبيرينس والشغلات عدا عن هذا كله، انه مشكلة انه ما فيك تروح على راس الزاوية تلف سندويشة فلافل او سندويشة شاورما تلاقيها. هاي لحالها مصيبة بالنسبة لإلي. فانا ضال شيكاغو ميشيغان ستاف، يعني انا اذا ما رحت تغديت مثلا، لا ما تفكر هاي الشغلات ما أنا مهمة بحياتك. الريزنت الانترن اللي عم يسمعوني هدول شغلات من الويل بينج كثير مهمين، العالم تنسى تحكي عنهم احيانا، لان انا ما بستمتع بالبطاطا المقليه والبرجر والبيره والى اخره. بدي صحن فاصوليه، بدي صحن ملوخيه اخر النهار، حس حالي اني انا لساتني فعلا انه هذا الشيء اللي عم استمتع فيه. صدقا هدول الشغلات لا تغيب عن بالكم، لانه شغلات كثير اساسيه بحياتكم اليوميه. رفقات اكيد ما في اهم من الرفقات هون، الرفقات ضروريين جدا يكون عندكم اصدقاء على القليل بتحكوا لبعضكم شويه مصايب شويه مشاكل من الريزيدنسي. وفي شغله اخيره بدي اقول لكم اياها، انا بلشت احسها هلا بعدين بعد سنين برات سوريا. في كتاب لادوارد سعيد اسمه اوت اوف ذا بليس، ما بعرف اذا حدا قريانه. ادوارد سعيد على فكره مفكر فلسطيني مرعب، هو كان بروفيسور بكاليفورنيا هون بشو اسمه. فبيحكي عن حالي نحن كلياتنا عم رح نمر فيها بوقت من الاوقات اللي تركنا بلادنا واجينا على بلاد الغربه. نحن تقريبا في عنا انفصام بالايدنتيتي تبعنا، شويه انفصال وليس انفصام. يعني نحن ما عدنا كتير سوريين ولا عدنا امريكيين، يعني نحن صايرين بمكان هون على الغلاف بين ان بتوين. يعني لا عم بقدر اذا رجعت على سوريا اندمج بنفس المجتمع واكون هذا السوري اللي طلعت من سوريا، ولا نقدر اكون هذا الامريكي. فنحن على زون هامش فعلا اوت اوف نو وير. فهاي المرحله كتير خطره على فكره نفسيا ومعنويا عليك وعلى المحيط لك. فانت ضل انتبه لهاي النقطه لحتى تقدر، يا اما انك ما بدي اقول تندمج، تتاقلم خليني اقول، لانه الاندماج كلمه ما بحبها. حتى تتاقلم شوي مع الجو، بدك تحيط حالك بناس بيشبهوك. يعني بناس ما ضروري يشبهوك بعرقك ودينك ولونك، بس ناس بيشبهوك بالسيتويشن تبعك. يعني انا مثلا عندي رفقات كانوا من اوكرانيا ولا من افغانستان ولا الى اخره ولا من جنوب امريكا، بس كلهم عم بفوتوا بنفس المرحله هاي اللي حاسين حالنا نحن ما عم ننتمي لهذا المجتمع وما عم نقدر نكون ببيئتنا الاساسيه. موضوع كتير احيانا ممكن يسبب شويه ضغط نفسي عليك، بس هذا شيء طبيعي بتمر فيه، رح تمرق للاحسن. خاصه بيجي مع اول الريزدنسي اللي بيكون كلها تغييرات والى اخره. انا بس حبيت انه هاي النقطه كتير رح تحس حالك شوي مانك بالمكان اللي انت متعود تكون فيه. ما نو سهل بس ما نو مستحيل. يعني اوريدي يعني يو جايز تقريبا قطعتوا اكثر من نص الطريق. واخر شغله حابب اقولها، انا بس بلش احكي ما عاد بعرف وقف. بس حاسس انه هذا مجال اقدر فيد خليني اقول اخواتي الصغار، لانه كلياتكم مثل هلا فيكم تقولوا انا اخي يمكن اصغر مني ب3 سنين وفي عندي كذا من الشباب مرقت اسمائهم كانوا جينيورز عندي. شغلي اذا فعلا حابب تستفيد من الريزدنسي لاكثر، لانه هي 3 سنين كثير قصيره، ثلاث اشهر، لانه 3 سنين ما بتقدر تلحق تعمل كل شيء. حاول فعلا 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 تمسك بايد السينيور تبعك، ما تتزحزح من حده باول على القليله 4 5 اشهر، مثل ما وقتها كنت تتعلم ابوك وامك يعلموك الاحرف وكيف تكتب الكلمات. صدقا نفس الموضوع، حاول تتعلم بس تاخذ العلم بالدرجه الاولى انك كيف تعرف السيستم. نحن ما لنا على فكره نحن ما لنا كسلانين بالعلم. نحن صحيح تعلمنا الطب العربي، صحيح نحن تاخرت معنا فتره لرجعنا تعلمنا لغه ثانيه من اول وجديد، بس نحن في خط بياني للاي ام جي، وخصوصا السوري لانه متعلم بالعربي. في خط بياني انك اول 6 اشهر متوقع انك توقع بجوره خفيفه بالخط البياني، بس مثل كانك عم بتشد سهم. صدقني هذا النيجاتيف بريشر اللي عم تعمله على السهم رح تطلع مثل السهم بعد 6 اشهر وتنطلق، وفعلا رح تلاقي لا تلاقي الفرق. لانه هاي الفتره الاولى اللي انت عم تتعلم فيها سيستم ما بتعرفه، عم تتعلم فيها ناسك. يا اخي بيجوا لعندي بيحكوا احيانا ما افهم عليهم شو عم يحكوا. انا عم بكون اذا اول مره شفت مريض كان عم بيقول لي اي فيل ويندد، انا ما عرفت عيدته كلمه اي فيل ويندد 5 مرات وما فهمت انها شورتنس اوف بريث. يعني منين بدي اعرف له ويندد؟ انا كنت بس عم كون فيري very يعني واقعي معاكم. فالموضوع اخذ معي 4 5 6 اشهر على القليله مثل ما قلت لك، يعني لابزورب الكلتشر والى اخره. بعدين بعد 6 7 اشهر لحالك بتحس حالك بلشت تطير، لانه ببساطه انت حاطط ايفورت كتير كبيره اوريدي، تعودت على الكلتشر شوي بسرعه، بلشت تفهم على شو حواليك، السيستم بلشت تمسترو مثل ما بيقولوا، خلص ما ضل شيء عليك شيء، لانه اصلا النولج عندك اياها. رح تستغرب انه انت البيز لاين نولج اللي بتتعلمها بجامعاتنا، او حتى يمكن هالسنتين اللي قضيناهم ندرس تبات وما اخره، رح تشوف الفرق ورح تشوف الكميه كيف. انا تجربتي يمكن غير شوي، بس انا بحس انه لا تكتئب باول 4 5 اشهر اذا حاس حالك دون. انت ما هلا تبلش تقارن حالك فيهم، وانت بدك تعرف انك انت عم تيجي على لغه جديده وعلم جديد مختلف تماما عن حالك. فما تقعد تقارن حالك فورا بالامريكان اللي بتشوفه من اول يوم بيعرفوا يحكوا ستوري وبيحكوا شغلات انا ما بعرف شو هي اصلا. يعني اول مره برزنتيشن عملتها امريكان جراد، انا حسيت قلت دكتور هاوس ما في مجال، انا وين جايب هالعجقه؟ صار من نوع من الامبوستر سيندروم، انه انا ما بصير اكون هون، لازم في هدول الشغلات كلياتها رح تصير وحتمرق فيها وشيء طبيعي. واخر شيء بتطلع خابص بالاي تي اي اخذ لك 90 95%. ليش؟ لانك شاطر بس انت ما عم تعرف مزبوط كيف تتعامل بهذا السيستم. فانا بس بدي اقول انه يعني خليك واثق بحالك، او خليكي واثقه بحالك، انتوا قد العزم. مجرد وصلتوا لهون هذا انجاز كتير كبير. تخيلوا كم طالب طب بسوريا، يعني نحن عندنا بسوريا كل سنه 5000 ل 6000 طالب طب، انتم من بين 25 او 30، يعني انتم نخبه النخبه. يعني حتى انا اقارنكم بطلاب الامريكيين ما عدل، انتم احسن منهم حتى، بس بدكم فتره بس لحتى شويه فرق الكلتشر وفرق السيستم. فخليك يعني مثل ما بقولوا راسك مرفوع، وباذن الله الامور بتصير اسهل مع الوقت. وفعلا بيست اوف لك كلكم. واذا في اي سؤال ليتر، انا في عندنا جروب واتساب ما بعرف اذا انتم عليه، في بكتبوا كتير اسئله، انا اكثر من جاهز لاني اجاوب على اغلب الاسئله. انا على نشط فيسبوك وانستغرام وات ايفر، لينكدين، اي سؤال اي شيء بقدر اعرفه او ما بعرفه بسالكم اذا ما بعرفه. وان شاء الله بتقدروا السنه الجايه تساعدوا كمان رفقاتكم واخواتكم اصغر منكم، لانه هذا بالنهايه يعني مثل ما بقولوا دين. وبالتوفيق.
الله يعطيك العافية يا دكتور،
الله
شكرا
يعافيك.
جزيلا. بالعكس نحن كلياتنا بنحب انه ندخل الجروب الواتساب اذا ممكن، يعني طريقة من طرق تشاركوا معنا اللينك
ما
او
هو
شيء.
انا اصلا ضافوني عليه، اسمه كتير بحس في اسئله عليه مفيده، انا ما بعرف اذا هو اصلا للسامز، هو اسمه الجروب واتساب، بتخيل كلياتكم سيريان ماتش 2026، بتخيل يمكن اغلبكم هنيك موجود. فما بعرف
عظيم.
انه في شباب وصبايا كتير عم يقدموا على الماتش، هو هيك يعني
اه
بتخيل هذا اغلبكم بيعرفوا، ما بعرف اذا
ايوه هذا هو، بس انا
فاذا في اي اسئله او ما شابه حتى اعمل لي منشن، اذا حسيت انه انا ممكن اقدر اجاوب على السؤال، انا ما عندي اي مشكله.
الله يعطيك العافية دكتور،
بالتوفيق.
شكرا جزيلا.
يا
شكرا
هلا.
جزيلا للجميع، وكان سيشن كثير حلو، وتعلمنا واستفدنا كلياتنا الحمد لله. وهي نهاية السيشن ونهاية سامز البوت كامب. شكرا جزيلا للجميع.
يعطيكم العافيه.
يسلموا ايديكم يا رب.
جزاكم الله كل خير جميعا.